Good morning to everyone. So we are expecting around 250 participants. We have, and people are trickling in. So thank you very much for attending this webinar. This is a transatlantic dialogue on extreme heat. So we do have a button for interpretation. We're going to have interpretation in 3 languages, English, Spanish, and Russian. Please find the interpretation button on the bottom bar. Thank you, Oliver. And which is a globe. Also, we have the Q&A function, which has a question mark on the bottom. And as you can see, we are also using the chat function. So please feel free as well to use that if you want to introduce yourself, to put your name and country or institution that we are representing. También tenemos la función de chat. Ustedes pueden usarlo para poner sus nombres y función y país que representan. I think we are we're gonna give just 1 more minute. So when we hit 9:05, we can start this amazing webinar. So thank you for coming. Gracias por participar. Tenemos participantes de varios países de Europa y de las Américas. Yo paso ahora la palabra a doctora Jerry Eichmans, que es la directora del Departamento de Determinantes Ambientales y Sociales y Ambientales para la Equidad en Salud de la Organización Panamericana de Salud. I now give the floor to Dr. Jerry Eichmans, who is the Director of Social and Environmental Determinants for Health Equity Department of PAHO, to kickstart this event. Thank you very much, everyone, for coming.
Thank you very much, Danielle, who is our Unit Chief on Climate Change and Environmental Determinants of Health. Thank you for everyone who is here with us. Good morning, good afternoon, good evening. I'm going to speak in English, so please find your language of preference, as Dr. Boes has explained at the bottom in the More icon. Dear colleagues, partners, participants from 2 continents, my name is Gerry Eikemans. I'm the director of a relatively new department in the Pan American Health Organization on social and environmental determinants for health equity. Welcome to this Transatlantic Dialogue, the first event in the series of policy dialogues that we're having as part of a transatlantic agreement, which is a joint initiative by WHO Europe, by the Pan American Health Organization, which is also the regional office of WHO for the Americas, and the United States Department of Health and Human Services. The Pan American Health Organization is very pleased to host this first dialogue. And the topic today, extreme heat and health, could not be more relevant. First of all, we are here in Washington, D.C. on another hot, beautiful summer day. But from year to year, from 2018, 2022, people in small island states in South and Central America, Africa, Asia, and also some parts of Europe have experienced the highest number of days of health-threatening temperatures attributable to climate change. From year to year, we have seen an increase. This is really important, and it's very important that we talk about it. But also, I want to take a moment to think about our Hurricane Beryl, who's making its destructive path through the Caribbean, threatening, while we speak, Jamaica, already having severely affected Grenada. And again here, we have a record, unfortunately, because Beryl is the earliest Category 5 Atlantic hurricane on record. On Monday night, yesterday, Beryl became the earliest hurricane to reach Category 5 strength in the Atlantic, and to beat the previous record by more than 2 weeks. Normally, those strong hurricanes only happen in July and August, and it's because of record warm temperatures, water temperatures, that this happened. So our solidarity is with our brothers and sisters in the Caribbean, and some of them will not be able to join us today in this webinar that's so important for them. On the positive side, just briefly, only last week during the Executive Committee of the Pan American Health Organization, PAHO member states approved the resolution on the policy for strengthening equity-oriented health sector action on climate change and health. And of course, talking about health, that also immediately puts a focus on equity. It's very different to experience extreme heat from a nice air-conditioned home versus a crowded room in a neighborhood in a city without any trees or shades. So equity is going to be very important also in this discussion. So this event is crucial and timely. It fosters collaboration and exchange of experiences among member states across the Atlantic, helping us to address these crucial issues collectively. So the Transatlantic initiative in general puts a focus on global health challenges in the post-pandemic context, discuss key indicators, inspire evidence-based action, promote knowledge exchange, and mobilize support for international initiatives. And this initiative also supports member states in achieving climate commitments, facilitating joint statements, action plans, partnerships to address climate change and health effectively. And the goal of today's dialogue is to strengthen health systems and community resilience against heat waves and extreme health. And based on this dialogue, we will develop a policy brief for policymakers on different approaches and opportunities to tackle extreme heat in our respective regions. These dialogues will also contribute to the larger goal of integrating climate change considerations, international health policies and strategies, promoting scalable solutions, and strengthening international cooperation. So again, virtual welcome to the region of the Americas, where we all together are going to discuss the issues that are at hand. We look forward to a productive discussion and meaningful outcomes from today's session. So to get us started, it's my real pleasure to invite our panelists that are going to give the opening remarks. And first, we're going to invite Dr. Rhonda Sealy-Thomas, our Assistant Director of the Pan American Health Organization. Dr. Sealy-Thomas, the floor is yours.
Thank you, Dr. Eichmanns, and I want to recognize other panelists, Dr. John Balus, Director of the Office of Climate Change and Health Equity, U.S. Department of Health and Human Services, Dr. Hans Klug, WHO Regional Director for Europe, Dr. Maria Neiriera, Director, Department of Environment, Climate Change and Health, WHO, member states, partners, colleagues, welcome. It's an honor for me to represent Dr. Jabez Barbosa, the Director of the Pan American Health Organization, for the opening of this very important event. I'm pleased that PAHO is convening this dialogue on extreme heat and health. This, as Dr. Eichmanns would have mentioned, is the first of a series of transatlantic dialogues being held as part of the tripartite collaborative framework agreement between PAHO, the European Regional Office of the World Health Organization, and the Department of Health and Human Services, HHS, of the United States of America. Through this partnership, we are working together to examine and address similar health challenges that populations are facing in both Europe and the Americas. One of these priority challenges is climate change and health. As we are aware, climate change is a global threat affecting the health and well-being and health equity. Its direct impact to health are seen in heat waves, droughts, wildfires, heavy storms, and sea level rise, while its indirect impacts include an increase in vector-borne diseases, food and water insecurity, undernutrition, and forced population displacements. We welcome the recent approval of the WHO's resolution on climate change and health at the 7th World Health Assembly in May. And it's my pleasure to convey, as Dr. Eichmann already mentioned, that during PAHO's 174th Executive Committee held last week, the resolution for policy for strengthening equity-oriented health sector action on climate change and health was approved. This policy sets out a framework aimed at building an equity-focused health sector response to climate change, advancing with adaptation and mitigation efforts, and ensuring that those populations most affected by climate change are prioritized and involved in the process. Today's dialogue is a vital platform for addressing extreme heat, one of the most topical and relevant issues, considering the increased temperatures being experienced globally. As an example, last week in Washington, D.C., here we experienced record temperatures of over 100 degrees Fahrenheit, almost 38 degrees Celsius, for the first time in 8 years during the month of June. A heat emergency plan was in place, and citizens were urged to take precautions to avoid heat-related illnesses and to check on neighbors, among other measures. This situation is a growing issue in the Americas, and over the past 2 decades, there has been a 160% increase in heat-related deaths due to heat waves in South America. Populations in countries and territories with lower socioeconomic development and poor infrastructure, as well as those in situations of vulnerability, such as the poor, individuals experiencing homelessness, displaced persons, migrants, children, the elderly, and outdoor workers are disproportionately affected by extreme heat events. Recognizing, prioritizing, and addressing their needs is precisely the aim of PAHO's policy on climate change and health. PAHO has been actively working with countries to mitigate the health impacts of extreme heat through various initiatives in the Caribbean. Additionally, PAHO has prepared guidelines and conducted heat mapping and response plans to communities across the Americas. Some other initiatives include the Caribbean Early Warning System project, which aims to advance early warning systems with an initial focus on heat health early warning systems. Under this project, PAHO, in partnership with the United States National Oceanic and Atmospheric Administration, the Caribbean Institute of Meteorology and Hydrology, the Caribbean Public Health Agency, and others, conducted a workshop in Jamaica in April 2024, which brought together meteorologists and health personnel to assess and strengthen capacities for advancing heat health early warning systems in the Caribbean. Collaborations with key organizations, such as this partnership with WHO's European Office and the United States Department of Health and Human Services, allow us to exchange knowledge and evidence, pool resources, and implement effective interventions on a broader scale. By participating in this event, countries of both Europe and the Americas can benefit from shared experiences, learn from good practices, and contribute to global efforts in addressing extreme heat and health. I look forward to the insights and outcomes arising from today's discussions, which will provide critical information for the development of guidance for policymakers, which will undoubtedly contribute to our collective efforts in combating the health impacts of extreme heat. Working together, we can develop innovative solutions and sustainable policies that protect our communities and build resilience against the impacts of climate change. Thanks to all our partners, to Euro, the HHS speakers and participants for your dedication to this very, very important issue. Thank you.
Thank you so much, Dr. Rhonda Sealy-Thomas, for your welcome words. We now will pass to the other side of the Atlantic, where we give the floor to Dr. Rob Butler, the Director of Communicable Diseases and Environment of the WHO Regional Office for Europe. And I also will ask Rob to introduce the video of the Regional Director of Europe. Go ahead, please, Rob. You have the floor.
Thanks very much, Jerry. It's my pleasure to do so. But before I do so, I just wanted to thank you, particularly Dr. Sealy-Thomas and the team, Jerry, Daniel. Really appreciate you hosting this first transatlantic dialogue. This is a very memorable milestone moment in us kicking off a series of these transatlantic dialogues, as you very eloquently already outlined, Jerry, that we're due to have in partnership with HHS. And I'm very much looking forward to hearing from John shortly and thank him for joining us. I should also note that this would not be possible without the support of Dr. Maria Nera, who joins us from headquarters. Maria, thank you so much for joining us today. We really feel your support in both regions. I think I speak on both regions' behalf in saying it's an absolute pleasure to be working alongside you on this very important agenda item. Our regional director, Dr. Hans Kluger, is with the DG currently, so couldn't join us in person, but has recorded a video. I'll ask for the video to be displayed shortly, but just to say that Hans is remarkably committed to climate change and health. He's already taken very early steps to strengthen our European Centre for Environment and Health that sits in Bonn, Germany. I'll mention this a little later as well. And to place climate change and health at the center point of the European programme of work for the 53 member states in the European region. So instead of me putting words in his mouth, maybe it's best we hear from him first, and then I'll just say a few words thereafter. If we could play the video, be grateful. Thank you.
The privilege to open the first in a series of transatlantic dialogues jointly undertaken by the distinguished guests, esteemed colleagues, welcome. It's a privilege to open the first in a series of transatlantic dialogues jointly undertaken by the World Health Organization in the European region, the Pan-American Health Organization, our sister entity across the Atlantic, and the United States Department of Health and Human Services. These dialogues take place within the context of a tripartite partnership established just over a year ago to address global health challenges in a post-pandemic context. And this is no exaggeration, none are more urgent than climate change. Today's discussion on extreme heat and health could not be more timely. The scorching reality of extreme heat is an ever-growing threat on both sides of the Atlantic. As I speak now, several countries in my region are already experiencing heat waves, and summer has barely begun. Last week, I was in the Central Asian republics where I felt firsthand the impact of soaring heat, with ministers across that region very concerned indeed. Heat waves are not only more frequent, more intense and longer lasting, they are jeopardizing the well-being of millions. Last summer, for the first time, triggered by the heat waves across our continent, I declared the climate crisis and extreme weather a health emergency for our region. Facing this endemic challenge, many countries have responded by developing and implementing heat health action plans. There is already a wealth of experience in our member states in tackling extreme heat, with many examples of innovative approaches. By exchanging experiences across the Atlantic, we aim to better equip our member states with the knowledge and tools necessary to strengthen resilience against this threat to public health. Over the next few hours, we will delve deep into science, strategy and solutions. And I'm very excited to hear your diverse perspectives. Your expertise will be instrumental in shaping effective approaches to tackling extreme heat on both sides of the Atlantic and beyond. And we can share with you what we are doing to support you, such as our European Centre for Environment and Health in Bonn, leading the update of the WHO guidance on heat health action plans. Armed with the new World Health Assembly resolution on climate change and health, the insights gleaned from this and subsequent dialogues will inform a series of summaries for policymakers that we will take with us to COP29 in Baku, beautiful Azerbaijan, a WHO Europe member state. These insights, these summaries will help outline the imperative for action, incorporating different approaches and opportunities to safeguard lives today and in the years to come, as we combat this existential threat, let's get to work and deliver. Thank you.
Thanks. Thanks very much. So if I'm to add just a few lines, I think it would be to say, as our regional director has noted, that heat waves are no longer an exceptional event in our region. They're rather an annual occurrence. The temperatures, I can attest, in Central Asia last week, where I was with him, exceeded 45 degrees centigrade, which was quite remarkable for the month of June. So this is a very pressing, urgent emergency. These heat-related deaths are totally preventable. And we should remind ourselves of that, because we think about the implications to our health systems in terms of workforce education, in terms of the profiles and training of the workforce that we will need to manage heat-related emergencies and heat waves, health system resilience, how we need surge capacity in our health systems, and of course, as Jerry's already very eloquently said, how these heat-related events and heat waves disproportionately affect the most vulnerable in our societies, the lowest income families, women, children, and the elderly. So equity has to be at the center point for dialogue on this particular item. There's no room for complacency, and I would argue that we need to learn the lessons quickly from our experiences in this region. We haven't done a good job of doing that over the previous 2 or 3 summers. We need to catch up. We need to learn from our own experiences and, of course, from each other. Here in the European region, we're launching and have launched our Keep Cool campaign, which we're actively progressing with throughout the 53 member states. We're actually providing a seminar on this to our WHO representatives in those 53 member states this week. The new WHO resolution, which both Rhonda and Hans were referring to earlier, is a huge step forward. But now we need to leverage our existing platforms and partnerships at global levels as well to help us get the job done, such as the Alliance for Transformative Action on Climate and Health Attach, which we're really promoting. Every member state joins and takes part in, as well as the regional platform on European partnerships on health sector climate action. So I'm really looking forward to this meeting. I will stop talking now. I'm very grateful again to PAHO HHS for joining us, and particularly to PAHO for hosting this first dialogue. Very grateful to you. Really looking forward to hearing more about how we're making health systems more resilient, better adapted, and more environmentally sustainable to, of course, save more lives in the summer ahead. Thank you all.
Thank you. Thank you very much, Rob. And thanks to both Euro and, of course, our Assistant Director for putting the frameworks on the resolutions, the global ones, the regional ones, the attach, as really are the frameworks that we have. And it's a question of moving ahead and implementing that. So, and one of our very important partners in this is, of course, the United States Department of Health and Human Services. I'm very pleased to have here with us Dr. John Balbus, who is the Director of the Office of Climate Change and Health Equity of the US Department of Health and Human Services. John, please go ahead.
Thank you. Thank you so much, Jerry. Huge thanks to our PAHO organizers and hosts, to Dr. Seeley Thomas, to you, Dr. Eichmans, to Dr. Buss, and thank you for the partnership with Euro and Dr. Butler and wonderful opening comments from Dr. Kluge. And I think we'll also hear from Dr. Nera on this panel, who a longtime colleague and friend and such a leader in our area. As Dr. Eichmans mentioned, my name is John Balbus. I'm the Deputy Assistant Secretary for Climate Change and Health Equity in the U.S. Department of Health and Human Services. And for us in the United States, heat has certainly become a much more visible and a more severe health problem over the past 5 years. The number of deaths recorded officially as being due to heat has jumped from an average of about 700 per year between 2004 and 2018 to as high as over 2,300 last year in 2023. A total of 645 people, almost as much as that annual average, lost their lives in just one county of the United States, Maricopa County around Phoenix, Arizona, in 2023. And when they looked into this, their analysis revealed that the victims were people who had many problems facing that. We've talked about the need to center equity. This put a really harsh quantitative face on it. 45% of the people who died in Maricopa County were experiencing homelessness. 65% had some drug or alcohol in their blood. And there are other statistics that reinforce that these were people who were facing disadvantage in Maricopa County. And while every community in the United States is unique, this is just one illustration of the disproportionate impact of heat on disadvantaged populations. In response, Maricopa County, along with many other counties and states around the country, and the US federal government are all expanding and increasing their responses to the health threats of extreme heat. And this workshop, bringing together the countries of the Americas, Europe, and the United States as part of the tripartite agreement, is very well timed indeed. I agree with what everybody has just said. And the objectives that we've started to mention of this transatlantic dialogue and initiative align with exactly what is needed at this time. Knowledge exchange and evidence-informed action is one of the objectives. It is essential. All of our countries are either right now facing, as we've mentioned, the threat of extreme heat, or have faced severe heat waves in the past years. Some countries have pioneered new early warning and response systems. We've talked about the new early warning response system in the Caribbean. This is a great time to learn about those and to think about how all of us can incorporate best practices in evidence-informed action and early warning. The initiative also aims to discuss how we measure heat-related illness and death in our countries. What are the indicators so that we can track trends and assess how well our interventions are working? This is critical. We have to be able to document if things are getting better or worse. And heat is easier to measure as a climate-related health threat than some other things, but we still can learn best practices and share how we do that. And the initiative showcases health sector leadership. For the United States, which in many ways has a greater divide between public health and healthcare than many other countries, the growing partnership between public health and healthcare and leadership from the healthcare delivery sector in particular is an important trend in addressing heat in the United States, and we'll talk more about that. The United States benefits from very strong collaboration among the different sectors and especially the different government agencies who are coming together to address the challenges of heat. Our National Integrated Heat Health Information System is led by our meteorologic agency, already mentioned the National Oceanographic and Atmospheric Administration, our Disaster Response Agency, Federal Emergency Management Agency, and our Department of Health and Human Services. And that NIHIS, that National Integrated Heat Health Information System, has 21 different agencies all participating within it. Together, we've launched numerous new data resources, indicators, funding streams, and supports for counties, states, territories, and tribal governments in the United States. And our Office of Climate Change and Health Equity is also a new resource, just 3 years old, to help the US address the health impacts of climate change. I'm pleased today I'll be joined by my colleague Hunter Jones from NOAA, the Oceanographic and Atmospheric Administration, and also from Candace Valsing of the United States Agency for International Development, who will describe some of those new resources and some of those new funding streams later in the day. And we'll try to break in and share our other relevant tools and lessons during the discussion in the sessions. But for now, I just want to thank everybody, thank all the participants today for being here, for bringing the exciting developments and the frustrating challenges in all of our countries, and for coming together to help us all develop best practices and better protect the lives of everyone in our countries, especially those at greatest risk from heat. I look forward to our discussions. Thank you. Back to you.
Thank you. Thank you very much, John, Deputy Assistant Secretary for Climate Change and Health Equity. Sorry to not have mentioned
Just
that.
added it on. You were absolutely right with the other title too. Thank you.
Wonderful. Thank you.
But it's nice that the United States has a Deputy Assistant Secretary working on climate change and health.
Absolutely. Absolutely. So very important. Thank you so much, John, for your important and supporting words. So now, last but not least, we're going to our dear friend, Dr. Maria Neira. We're so pleased, Maria, that you can join us. Maria, as she doesn't need introduction, but still, she's the director of the Department of Environment, Climate Change and Health at the World Health Organization. Maria is really our leader in this field, pushing boundaries since years. And we really, really are very, very pleased to have you here with us. And you can also speak in Spanish, Maria. We have the interpretation, so we can use it. Up to you. Very, very welcome. And please go ahead, Maria.
Thank you, Harry. Muchas gracias. Yeah, it's true that I love Spanish, but with the permission of Hector and others Spaniards that I see that are connected, I think I will speak English because probably it's the language that will be more spoken by the participants. Dear Egemans, dear Butler, dear Rachopi, Dr. Balbus, I call you doctors, but for me it's Gary, John, Francesca, Danielle, and John. It's such a pleasure to see you. And dear Assistant Director, thank you very much. Any initiative we take these days about joining forces, aligning, and strategically coordinating action is extremely timely and important. Dear colleagues, thank you very much for inviting me and for organizing this timely webinar. I see that many people is connected, and I want to use well my time, the one that generously you are giving me. So just one comment first to start. Wherever you are, take a newspaper and you will see that there is a headline about heat waves. I think heat waves are probably becoming now one of the clear representation of how people is linking climate change and human health. And it's not because it's new. We have been producing documents, and our colleagues in Neuro, they know that very well in Bonn, about what heat waves represent for the health of our people. I will not share that with you because you will have very strong and very good scientific presentations later on how heat waves are affecting our population, the mortality associated with that. I prefer to focus a little bit on what we need to do. Allow me to start by saying that if we want to do something about heat waves, don't forget that first of all, we need to keep advocating and giving very strong messages from the public health point of view about the need to mitigate the causes of climate change. Only by mitigating the causes of climate change will be able to start to reduce the frequency, the number, and the intensity of those heat waves that are affecting all of us now. So don't forget about the role that as health professionals, we are having an enormous responsibility to remind our decision makers, our governments, the negotiators at COP, that they are not just negotiating with Celsius degrees, with percentages of emissions, they are negotiating with our health. So unless we start to seriously mitigate the causes of climate change, we will not be able to have a positive impact on heat waves and other consequences, terrible consequences that climate change is having in our health. Apart from mitigation, where we have this very, very strong role, adaptation. Adaptation will consist on the political influence. As mentioned already, we are going to the COPs, having more and more impact thanks to the collaboration of everyone. COP28 has been an incredible moment where health took the front stage, where was the headlines. Health was the argument. Remember that when we went to COP, we presented a report that it was called the health argument for more climate action, where this year our intention is to present a report that will say health is the argument for climate action. Health is the argument. We need to make sure that everybody understands that there is no way to postpone, to have COPs for yet another 28 years or 29. We need to treat this as a public health emergency, and therefore you are not entitled to 28 years to negotiate a public health emergency. On adaptation, ATTACH has been mentioned. Thank you very much. A few months ago, all of you, almost many of you at least, were in Madrid, where the Ministry of Health has very nice on hosting this very first meeting presential of the ATTACH community, which is only growing on such a positive way, generating a lot of commitment by the health professionals because they feel that they are doing something very concrete, very tangible on reducing our own carbon footprint, preparing our health systems to cope with what is not very positive. I mean, we need to be prepared by creating climate resilience health system, by the no regrets investment, because after all, what we are proposing to have climate resilient health systems is something that is no regrets, is better vector control, is better epidemiological surveillance, is early warning systems, is about preparing the health professionals and many other things that are, after all, a non-regrets, a fantastic investment, no matter what, for our health systems. And of course, reducing when it's possible our own carbon footprint, sharing all of those information, experiences, and knowledge, and again, making sure that soon we will reach this reduction and zero carbon neutral of our health systems. Sharing all of these experiences is extremely positive. And of course, the resolutions. We just passed the resolution at the World Health Assembly. We have the pieces that are now completing our puzzle, but a lot of things to do, and particularly with whom we will be doing all of that. Let me bring here a partner that is absolutely fundamental, and we need to engage with them. We are already very much engaged, but even more, which are the mayors of our cities, because most of those heat waves are occurring now in big urban areas where people is living in conditions where there is very little green spaces. We need to promote more green spaces. There are several studies, and one that will be published in a couple of days, demonstrating once again that when you have trees, when you have a green space, you can even reduce by 12 Celsius degrees the temperature in a city. So those interventions are fundamental, creating shadows, creating places where people can be a refugee of these climatic conditions when their temperature reaches situations that are absolutely impossible to study or to live or to sleep. So the cities are now engaged with the mayors on doing a map of the vulnerable population, making sure that we identify those groups that in case of heat waves, there will be the ones more affected, and creating some special spaces for them. I was just in Italy yesterday, and they are now identifying places, theaters, cinemas, libraries, other places where people can spend between midday and 5 o'clock. And this is happening in many cities around in Europe, and I'm sure that Transatlantic as well, France, Spain, many others are doing this type of exercises, creating as well livable areas nearby the river when you are lucky on your city to have a river. And therefore, this action that the mayors and local authorities can have on fighting and preparing for the very often and intense heat waves that we are having now will be there. We will have all of these recommendations, making sure that WHO will bring the health community as such, and the benefits we can obtain from all of these interventions are enormous. One of the immediate one will be the reduction of the heat waves, but most of those interventions will as well contribute enormously to reduce air pollution, and therefore having incredible results in all of that. Colleagues, I'm so pleased to see action and all of that. I count on all of you in Baku. We have to make sure that, again, in Baku, the health as the argument for our action will be very prominent in the agenda. And altogether, we are a force and a movement that nobody will be able to stop. So let's join in forces, because we will be unstoppable. Thank you very much, Gary and colleagues, for this opportunity, and thank you all.
Thank you so much, Maria. And with this last words that we're an unstoppable movement, I think this is really a good start of the rest of our webinar. I apologize for going a little bit over time in this opening session, but I think there was so much richness and so much content here. This was not a regular protocol. We can feel the passion and the urgency from everyone. So again, thank you all so very much for being here in the opening session. And I now pass the floor to the persons who are going to coordinate session 1 of this webinar. Again, thank you very much, and let's keep this energy going, and all the best of luck with this webinar. Thank you.
Thank you so much, Jerry. Hello, my name is Oliver Schmoll. I'm from the European Center for Environment and Health, WHO, and I'm supporting the moderation of the coming 2 sessions. It's great to see you all. Thank you so much for all these very bold opening remarks. Yes, indeed, we are unstoppable, and we now also will move on unstoppable in the agenda. So the first session is really concerned today with setting the scene. We have heard already a lot on how badly heat is affecting health, and that we are seeing more and more heat waves coming up across the globe. And it's my great pleasure now to invite Joy Schumacher-Guillemot, who is from the joint WMO Climate and Health Office, which is based in Geneva. Joy, it's a great pleasure to have you with us. And I would like to invite you to share with us a little bit the latest state of affairs when it comes to heat waves, but also elaborating on what exact impacts we are actually talking about on health that is resulting from excessive heat. Joy, over to you.
Thank you very much, Oliver, and it's a pleasure to be here today. It's fantastic to follow the panel that has just introduced many of the issues that I'll summarize in this presentation. So just confirming you can see the slides.
Yes, we can see the slides and hear you well.
But they're not advancing.
That's true.
Okay, there we go. Okay. So from the World Meteorological Organization, where I work and lead the Joint Office on Climate and Health with WHO, WMO is the authoritative voice of weather, water, and climate. And we are monitoring the Earth's systems and watching the world get closer to the 1.5 degrees Celsius lower limit of the Paris Agreement on climate change. And this target of keeping below 1.5 is really important because it represents not passing a boundary of where impacts are thought to be manageable versus causing irreversible damages. And you can see in this chart that we are dangerously close. And unfortunately, parts of the world right now are surpassing temporarily the 1.5 degree limit. WMO has been issuing a red alert for quite a while now, but this is really serious. The pace of climate change is accelerating very quickly, and it affects everyone everywhere. And as these global temperatures rise, what we expect to see is more hot weather and more extreme hot weather. And as we've already heard, that is exactly what we're seeing. Unprecedented, record-breaking heat events every year on every continent. 2023 was by far the hottest year on record that the Earth has experienced, and that trend has continued month after month into 2024. According to the World Weather Attribution Project, over the last 12 months, 78% of the world's population have experienced at least 31 days of extreme heat. And that was made at least twice as likely due to human-caused climate change. Now, what this looks like locally is that all major characteristics of heat are increasing. Here are the trends for the United States, and as you can see, since the 1960s, decade after decade, the heat season is getting longer, the number of heat waves is increasing, and these heat waves are lasting longer and are hotter. We are also starting to see new phenomena in the climate system, such as concurrent heat waves, meaning that multiple large heat waves are occurring at the same time and affecting a much larger geographic area. So the impact is no longer on a single city, but an entire region. And regions are important because they share energy grids, food supplies, water systems, putting stress on a whole system and a much larger population, and just amplifying and expanding the scope of the risks and impacts that need to be managed. And so here you can see in 2018, the Pacific Northwest of North America, Europe, the Sahel, and China were all experiencing heat waves at the same time. 2022 saw the same pattern. It worsened the droughts in Europe and China, it drove crop yields down, and it affected the global economy. We are also seeing a co-occurrence of extreme heat and drought, and an increasing co-occurrence of heat waves and localized extreme sea level rise, which affects coastal flooding. So another really important domino effect is fire. Because of course, hotter, drier conditions make fire much more likely and more dangerous. So this graph from Europe in 2022 shows that as the temperatures rose in red, that blue line is the burn area and the number of acres across Europe, which was also on fire at the same time. So this is, of course, driving physical risks and losses to those that are near the fires, but also respiratory impacts to anyone who is exposed to the smoke plume that is nearby, but also far away. So, for example, last summer in the United States, fire smoke from Canada severely impacted the northeastern corridor thousands of kilometers away. And you can see this spike in ambulatory cases for severe asthma over several days in New York City, far from the origins of the fire. But the problem of heat goes far beyond just heat waves to think about extreme heat conditions and chronic heat. And so if you look at this climate zone map and think about where you live and work, how is the heat experienced? Is it hot all the time or just periodically? Is this dry heat or humid heat? Because these have big differences for the kind of risk that it poses. So across both the Americas and Europe, you have multiple different climate zones. There are temperate zones that have seasonal and periodic heat waves that have big impacts on mortality because populations are less acclimatized to those temperatures. But then you also have tropical and subtropical zones like the Caribbean, which even though people may be more used to the heat, they are also living far closer to the upper limits of thermal comfort and livability. And so when you have extreme heat conditions and prolonged high temperatures in these tropical, subtropical regions that are already humid and hot, the impact can be really severe. So looking to what the Intergovernmental on Climate Change tells us, our choices right now affect how we and our future generations are going to experience the world. Unfortunately, we are already locked in to a hotter future. The greenhouse gases in the atmosphere will continue to warm the planet for at least another 100 years, but we have to stop adding more. You can see even in the very low emission scenario, this is leading us into a warmer, more dangerous future. And that represents stopping burning fossil fuels almost entirely today. So at this point, the conversation is not about whether or not it will be hotter, but how much hotter it will be and what are we going to do about it. So the summary of evidence also tells us that as more people are exposed to extreme heat, we can expect that more people will get sick and die. We know that this heat risk is growing, especially at the confluence of aging populations and urban populations. And this means that not all regions will be impacted similarly, particularly due to differences in the population growth and aging in tropical and subtropical regions. We also know from specific studies that areas like Central and South America and the Mediterranean are projected by the end of the century to be some of the most impacted by heat-related mortality. So what are some of the other impacts? Well, unfortunately, heat really impacts almost everything. It impacts people's health and their ability to be active and productive, our ecosystems, our cities, our economies, and the way of life in some places. Heat comprehensively is really damaging, and the impacts are on many of what we know are environmental and social determinants of health. And when it comes to health and how heat impacts us, we have to remember that no matter who you are or where you live, the human body needs to stay at around 37 degrees Celsius or 98 degrees Fahrenheit to function properly. Any deviation from this is going to have an impact on health. And when there is too much heat in the body's going to work as hard as it can to expel the excess heat through the skin. But if the body can't do this fast enough, then we start to have symptoms of organ dysfunction. And that may be headaches and dizziness, but it may also be more severe issues as heart attack and kidney failure. But when the body has exhausted its own ability to cool down, heat stroke sets in. And for me, we should all be afraid of heat stroke in the way we are afraid of heart attacks, because heat stroke is a medical emergency and it's a race against time. You have about 30 minutes to start dropping the body temperature and stop the sequence of organ failure that can lead to death. 30 minutes. That means that access to trained and equipped medical care is critical, because your chance of survival without medical intervention is only about 20%. So obviously the goal is to prevent the onset of heat stroke in the first place. And as we've already heard, heat deaths are preventable. In the last few years, we've also seen a huge upsurge in research of how prolonged heat exposure is impacting a broad range of health outcomes, from mental health to fertility and birth outcomes. And this is not surprising given that heat impacts all of the organ systems in the body. Now, let's talk about vulnerability. Who gets affected is determined principally by two things: your physiological state and how much heat you are exposed to. And so that is why we are particularly concerned about the elderly, who have an aging body that's unable to cool down efficiently, and often pre-existing conditions like heart disease, the poor and disenfranchised, and outdoor workers and athletes, because they're not only exposed to the outdoor conditions, but their bodies are creating additional exertional heat from the effort they're making. Other factors are also really important, like humidity and acclimatization. And as we've already heard, urban areas are a big priority. But we can't only think of heat as an urban problem, because rural poverty is amplifying the vulnerability of communities. And heat's also amplifying a lot of other health risks. And we know that warmer temperatures encourage bacterial growth and vector proliferation. That's why we see foodborne outbreaks during warmer periods. We see longer biting periods for mosquitoes and ticks. We also see an increase in occupational injuries because heat impacts coordination and judgment. Rates of drowning also go up because you have more people in recreational waters. And so when we think about the health impacts, we have to think quite widely, and we have to think about the social and environmental determinants of health and all the heat-sensitive health impacts. So heat is also not only bad for people, it is really bad for the environment, because our ecosystems have evolved for millennia within very stable temperature conditions, and they just don't cope well with extremes. And really importantly, our technology and infrastructure that we depend on simply fails under high temperatures. From cell phones and computers, electrical cables, and pumps for water, when they fail, they're often disrupting life-saving services that we need for cooling, for water, for transport, for delivering healthcare, and keeping communities safe. But the real stress of heat is felt by the poor, as we've already heard, because they have the least options to escape the heat. These are the slum dwellers under a metal roof. These are farm and factory workers who can't take a break. According to the International Labor Organization, in a new report this month, 2.4 billion workers are exposed to dangerous heat. And that's resulting in 23 million work-related accidents due to heat. Those are big numbers. And when it comes to the economic losses, frankly, we don't know what the impacts are in the health sector. But when you start to tally the lost labor, productivity, fire and crop losses, closed airports, water demand, the economic impacts of heat are really quite startling. And of course, as we've already heard, heat is an equity issue, because those who are already most marginalized are disproportionately affected. This is informal workers to rough sleepers on the street to entire communities that have limited access to green space. I personally predict that access to cool spaces and critical services is going to become a rights issue. And we're already starting to see this in the occupational space, where workers are demanding protective policies that give them the right to water, the right to rest, and not working during dangerous conditions. But of course, that's part of the poverty cycle, because that also means lost wages for millions who can't work when it's too hot, perpetuating poverty. So emergencies are the other concern, because when the power grids fail, when there are no fans, there's no cooling, no refrigeration, no cold change, then what happens? When sports events, concerts, religious gatherings are poorly prepared for the heat conditions, then what happens? They end up in our hospitals. Civil protection authorities are really quite concerned about the amplifying humanitarian needs related to these systemic stresses and emergencies that heat brings. Because we also know that repeated loss of livelihoods, limited options also drives migration. It drives a number of social tensions. And the correlation between summer heat and violence is well documented in many countries that we need to take note of. So the challenges are not just about emergencies. And
Joy,
yes.
may I kindly ask you to come to a close if possible?
Sure.
Mindful of time. Thank you so much.
So when it comes to the health sector, many of you know from experience that heat waves overrun ambulatory care and infringe on standards of care. And if this happens once a summer, maybe you can deal with it. But the increasing frequency means that this is happening multiple times in a summer, multiple months in a row. It starts to present a problem for health systems. And the heat stress on the health system really starts with frontline health workers. Reports from around the world during the COVID-19 pandemic showed us what a serious problem heat stress can be for health workers. They're wearing PPEs and other protective gear that's driving heat strain. They're working long hours, and we have to protect health workers if we're going to protect our communities. But the real dilemma for heat is here. And Maria has already alluded to this, that we are stoking a fire that we are really unprepared to fight. Emissions reductions are not only slow, but they're estimated to increase on current trajectories. And until we increase our levels of preparedness and resilience to live safely in hotter conditions, we will keep seeing more impacts. So the bottom line here is that the slower that the net zero transition occurs, the more miserable and expensive the future will be to adapt to. We have to invest in both adaptation and mitigation pretty quickly and at scale to break and reverse this vicious cycle. In the Global Heat Health Information Network that I lead along with NOAA and WHO, we have been listening to partners and governments from around the world for many years now. And the gaps that you see here are 6 of the main challenges that I'm sure we'll hear about more in the coming presentations, which are really undermining our ability to stop this cycle through public awareness, heat governance, connecting science to policymakers, enhancing social protection and social nets, bringing in environmental cooling, and preparing to respond to emergencies. So I will leave it here, and I thank you very much for the opportunity today.
Thank you so much, Joy. Bravo. This was an excellent overview of the evidence as we know it at the moment on the developments that we see in accelerating heat, the health impacts, but also with clear messages on how it impacts other areas of society, social systems, the vulnerable, and also the need of the health sector to step up its response to the accelerating heat. That was a perfect overview, even though I have to say slightly dystopic in a way. So we need to keep our spirit and our responses, which brings me now to the next session where we have a lineup of presentations from 5 different countries, from the Americas and from Europe, to share a little bit the responses that countries take in light of heat becoming more and more a health issue in countries. And it is my great pleasure to invite as the first speaker Caroline Tateshi, who is the director of Climate Change and Health of the Climate Change and Health Office at Health Canada. It's good to see you again, Caroline. And Canada was big in the news last year with the heat waves on the one hand, but also the wildfires converging at the same time in Canada. And these news went big around the globe. And I'm looking forward to hearing from you, Caroline, on what Health Canada is currently doing to beat the heat and to respond to the ever-growing adverse experiences. Over to you, Caroline.
Great. Thank you very much, Oliver, and thank you very much to all the organizers at PAHO, the World Health Organization in Europe, and headquarters, the US, and to our colleagues at the WMO, Joy, that just spoke. Very much appreciate the collaboration over the years and very much appreciate you convening this discussion today on this critically important topic. And as you mentioned, Oliver, Canada has been experiencing extreme heat along with other extreme weather events. Next slide, please. So I'll speak a little bit to provide you with the context. So historically, Canada really has been a cold country. We have cold winters, lots of snow. Most of our population lives near to the southern border of our country, given the kind of harshness of our climate. And this context is important in understanding how we're faring in adapting to extreme heat. As it's not a issue that we have historically been dealing with. So from extreme cold perspective, our infrastructure, our houses, our homes are designed to keep the heat in, keep the cold out in the winter, which makes it very difficult then to cool things down during summer temperatures. Our behaviors as well, we learn as children how to deal with the cold and the snow in the winter. We look forward to snow days where we have a lot of snow and may get a day off of school. But these types of natural kind of adaptations that we've had to cold weather are now needing to be applied in the context of extreme heat and being a little bit more deliberate in terms of how we're specifically adapting then to the extreme temperatures that we're facing. In Canada too, health is a shared responsibility between our federal, provincial, and territorial governments. And I work at Health Canada, the federal Ministry of Health, and so we support our colleagues in provincial and territorial and local governments to adapt to the changing climate. And while we've already seen many extreme events in Canada, we're also forecasting many more, unfortunately, in the future, given our changing climate. And then in order to address these challenges that we face with climate change, Canada released its first national adaptation strategy around this time last year, and includes objectives and targets on protecting the health of the population from extreme heat. Next slide. So heat really is a health issue in Canada. Again, as mentioned, although we are a cold country, we've had many unfortunate incidences of mass casualty events related to extreme heat, and most recently around 2021. We expected that this is an underestimation of the extreme heat events that we've faced, and we continue to work towards better increasing the data and information that we have to understand who's really at risk. Next slide. So at the federal level, our Climate Change and Health Office works with partners across Canada, including our provinces and territories who have the primary responsibility for delivery of healthcare in Canada to address many climate-related health impacts, including extreme heat. Since around 2008, Health Canada has focused efforts on increasing the adaptive capacity in Canada to reduce the health risks of extreme heat. So for example, we've been working with our partners to expand heat alert and response systems around Canada, to work with our National Meteorological Service to implement health evidence-based heat warnings, to support action on the ground, to take a variety of measures, including warning the population, opening things like cooling centers, checking in on vulnerable populations, working to train healthcare workers, public health professionals, pharmacists, and others on the heat health risks, and really raising awareness amongst people in Canada about who's at risk and what people can do to protect themselves. We also work to undertake scientific research to ensure all of our activities are evidence-based and ensure that we have an understanding of how heat specifically is playing out in the Canadian context, again, in a context where we're used to cold and not heat. And we very much appreciate over the years the close international partnerships that we've had with many of the folks on the call and others around the world in understanding how to adapt. Next slide. So a variety of areas, as mentioned, we work on heat warning triggers and heat alerting systems, working on heat health messages and how do we communicate better to the public to understand the risks and health protective measures, working to support guidance on heat alert and response systems, and more recently have been working to understand and address the impact of specifically indoor heat. As mentioned, our infrastructure is not designed to keep us cool in the summertime. And so looking to understand how do we address those specific indoor heat risks. So for example, we've been working with our colleagues at a local university, the University of Ottawa, who has been undertaking physiological experimental research in laboratory settings to understand, in particular, how does heat affect particularly vulnerable populations such as older adults, to really understand what is that safe upper limit of heat exposure and how that might be applied in a context of putting in place guidelines for protecting health from indoor heat in particular. Next slide. So one example of how this played out in the Canadian context, tragically, was in the 2021 Pacific Northwest heat dome. So on the very west coast of Canada, in primarily the provinces of British Columbia and Alberta, there was a significant heat event which saw temperatures rising to nearly 50 degrees Celsius, which is completely unprecedented in the Canadian context, and was really levels of heat that we weren't expecting to see for many, many decades. And unfortunately was led to more than 600 deaths, primarily amongst older adults and people with chronic and mental illnesses. And this particular heat event has, however, led us to understand a number of things about how the heat plays out in the Canadian context, and we're working hard with our partners to understand and better protect populations for the future. So some of the lessons learned from this particularly extreme event was that people who were at risk were some of the populations that we are familiar with: people who are 65 years old or older, people low incomes, people living in urban heat islands, so in urban settings where it gets very hot with very little green space, people with existing chronic conditions, those with mental illnesses, particularly schizophrenia. Populations with schizophrenia had a number of times risk of death than other populations, and we've been supporting research into better understanding those particular mechanisms as to why that is occurring and how can we better protect this particular population, as well as those with substance use disorders. And as mentioned, 98% of those who had died indoors. So this really points to a risk with infrastructure and the need for the health sector to be working intersectorally with colleagues across the built environment and natural environments to reduce risks to extreme heat. We found challenges with the health system being able to respond. Joy mentioned some of those issues about needing to respond quickly and being overwhelmed. This was also happening in the context, of course, of the ongoing, at the time, COVID-19 pandemic related public health measures and impacts to the health system. and then had found conflicting and unclear messaging going out to the population. Again, because we're normally a cool country, it was a challenge to communicate to the population just how serious a risk heat was. Normally, we think of heat as being, we welcome the summer, we look forward to going outside and enjoying the heat, but this was a different type of heat, and it was difficult to be able to communicate that clearly to the public. And some challenges in how the heat risks were being reported. So for example, you might see often pictures that are accompanying kind of messages in the media of people laying on a beach, really enjoying themselves, doing fun activities. But then looking at the article, you understand that heat is a very serious health issue. And so this conflicting messaging of enjoy yourself outside in the heat, but also this is a very serious health risk, was conflicting and made it difficult to communicate to the population. And then certainly some of the lessons learned, again, because of the structural issues with our built environment, the real need to protect at-risk populations and really tailor messages and measures to ensure that those at-risk populations are being reached by public health measures, and the importance of really clear, consistent messaging during these times, including times of coinciding crises. So Oliver, you also mentioned that at the same time we were and have been facing many occasions of having both heat and wildfire smoke be concurrent risks, and needing to ensure that we have clear messages. For example, some of our classic messages that we've been working through is when there's a heat event, we say, open your window, let the breeze in, cool your home down. But of course, during a context of a wildfire event, there might be a lot of wildfire smoke. And so the wildfire smoke protective messages might say, close your windows, keep the air out. So needing to work through how do these various climate and environmental hazards combine, and what kind of messaging is required for the population so that they have clear messages in terms of understanding what they need to do. Next slide. And so we see many opportunities to be working forward with our international partners, lots of opportunities to be collaborating on research projects to better understand how heat alert response systems should be adapting to this changing climate as we see much more extreme events. And particularly, how are we protecting our vulnerable populations? We see also potential opportunities for coordinating approaches on heat warning systems, understanding how thresholds for alerts and associated heat health messaging and methodologies deployed for both how health is factored into decision-making on heat warning systems. And consideration for effective emergency level heat alert thresholds, again, as we see much more extreme heat than we have seen in the past. And then sharing information and knowledge on how to address issues related to indoor temperature safety, including opportunities to identify health evidence gaps, leveraging best practices, and how we can work across sectors to be able to address these issues. So I'll leave it there. Thank you very much for the opportunity, and look forward to the other presentations.
Thank you very much, Caroline. And this is really impressive. And thank you for sharing this rich experience. I pretty much like your messaging on that this is nothing that the health sector can tackle by its own, but there are kind of multiple links to different stakeholders and players to manage this, starting from the med services, but also all the way up also to liaising with urban planners on, and designing places that are resilient to heat, and speaking green space, but also developing cooling islands, and looking into the longer term planning of buildings and cities. And I think this is one of the strategic long-term investments. Great to hear all this work coming up from Canada. There are a lot of lessons to be learned. Thank you so much. I would now like to roll on the other side of the Atlantic, very close to the Adriatic Sea. And it's my great pleasure to introduce to you Margarita Spazinowska, who is a public health officer at the WHO country office in North Macedonia. And Margarita will speak about the efforts in North Macedonia on heat health. And as far as I understand, Margarita, you will also put a little bit of a focus on engaging communities. Caroline has already spoken on, engaging with risk groups and communities. And I understand that you in North Macedonia have also made experience with that. So great to have you with us, Margarita, and I'm looking forward to your contribution.
Thank you very much, Oliver. Thank you, colleagues. It's a privilege to be part of this transatlantic dialogue. Shall I share the screen or the presentation will be shared by your side?
Please share, Margarita.
Okay, so I hope it's visible.
It is. Please put it in the full screen mode, and then I think we are ready to go.
So it's already been said that heat waves possess significant health risks for many countries globally, and is the case also for North Macedonia. And as an introduction, I will just show a few figures from the very latest Lancet countdown report, where we can see that heat-related mortality for the population in North Macedonia, for example, for the population group of 65 plus, has increased by 113% in the period 2018-2022 in comparison to 2000-2004. And also we can see that future projections in 20 years for now, we have expecting a increase in heat wave days for both scenarios. So in North Macedonia, we developed heat health action plan in 2011 to address the escalating risks posed by extreme temperatures and heat waves. It was led by the Ministry of Health and the Climate Change Health Commission, and it had several objectives to decrease morbidity and mortality associated with extreme heat events and temperature, to raise awareness among citizens and health sector workers about climate change health impacts, emphasizing the need for public health measures and preparedness, and to mobilize resources effectively to manage and mitigate heat-related health effects, fostering collaboration among various stakeholders. We worked with many partners in the government as well as in the society. In the design and the implementation of the plan, several smart solutions were integrated to enhance effectiveness and responsiveness. Firstly, a cross-governmental body, the Ministry of Health, Climate Change and Health Commission, was established to coordinate heat wave alerts across various phases, the green, yellow, orange, and red, ensuring timely responses and collaboration with relevant stakeholders. Secondly, a comprehensive early warning system managed by the Hydrometeorology Agency was implemented, and this system notifies the Ministry of Health Climate Change Committee members about alert levels through web-based platforms, SMS, mobile applications, providing 24 to 48 hours advance heatwave warnings. Additionally, a very robust communication strategy was devised to inform the public about the protective measures during heat waves, and specific protection plans were tailored for the most vulnerable groups of the population, ensuring targeted support and care. Furthermore, annual monitoring and assessment of heat wave effects were conducted using defined indicators aligned with the National Heat Wave Plan. In addressing public awareness around heat health, our strategies focused on collaboration, as we have already mentioned, and direct engagement with the NGO sector, particularly leveraging the Red Cross networks of volunteers, enabled extensive community outreach and field activities during heat waves. Tailored educational leaflets were designed and developed for diverse audience, including the general population, health professionals, health workers, and elderly individuals, and were distributed through the Red Cross volunteers. And these materials provided essential guidelines on heatwave preparedness and health protection measures. Additionally, a dedicated SOS line was established to the Red Cross, offering direct assistance and guidelines to those in need during severe heatwave conditions. We also actively involved the occupational health services, particularly the WHO Collaborating Center, which is the Institute for Occupational Health in North Macedonia, to implement protective measures ensuring workspace safety during heat waves. This initiative aimed to safeguard the health and well-being of the working population, which is almost 1/3 in our country. Recognizing the pivotal role of media in public awareness, we conducted media training sessions focused on educating journalists about the health impacts of heat waves. By building alliances with media outlets, we strengthened our capacity for timely dissemination
of heatwave alerts and protective measures to the public. These collaborative actions with the non-governmental sector, with occupational services, with the media, reinforced our commitment to a holistic approach in mitigating and addressing the health risks associated with extreme temperatures, promoting resilience across all sectors in North Macedonia. In conclusion, I would like to say that the Heat Health Action Plan in North Macedonia stands as a pivotal initiative in addressing these escalating health risks, and we have succeeded through strategic collaboration with many partners across the government and across society to raise awareness and implement effective measures to protect vulnerable populations. While this plan achieved significant milestones, there are many challenges like the political commitment, which needs to be ongoing, sustained leadership and governance, institutionalization of processes, and adequate allocation across all levels of government and the local societies remain essential to ensure its continued success. And by learning from our experience and enhancing monitoring and evaluation processes, we can further strengthen our resilience against the increasing challenges of climate change-induced heat wave, because no one should be left behind. Thank you.
Thank you so much, Margarita, for sharing the experiences from North Macedonia. Great to see that the country has already started quite some time ago with the heat health action planning in the country. I particularly liked the various keys on the piano that you play in engaging civil society and other stakeholders in order to make sure to have a timely reach out and warnings to the vulnerable, but also to the general population, your cooperation with the media, but also having a focus on occupational health, on workers, something that we haven't mentioned so far during this webinar, but this is a whole own world in itself if you think of outside workers, etc., etc. So thank you so much for putting these foci, Margarita. I should have done a better job as a moderator by saying at the beginning of the session that everyone here online is very welcome to put questions or comments into the question and answer function of Zoom. That should be a button easily visible at the bottom of your screen. So if you have any questions to the presentations or any comments, please plug them there and you'll make sure to respond to them. And please feel free to engage through that Q&A function of Zoom. I will now move on and we stay in Europe for the moment and we move northwards to Germany in this case, a country which has until the recent past hasn't experienced so many heat waves at scale, but the situation is changing rapidly. We had already the first heat waves here in Germany, already a couple, and it is my great pleasure to introduce to you Tim Paulus, who is the head of the Environment and Health Protection Climate and Health Unit at the Federal Ministry of Health in Germany. Welcome, Tim. Great to have you with us. And Germany is one of the countries which has a federal structure, so where basically the central government is doing work on heat health, but also the federal states, Tim, right? So I think this comes with a set of different approaches. And I'm looking forward to hearing from you what is being done in Germany at this point in time. Over to you.
Yeah, dear Oliver, dear colleagues, I hope you can see and hear me clearly from Cologne today. Cologne in Germany is a rainy, cold day today, and in terms of prevention, I pretty much like to talk about heat and heat prevention on a cold and rainy day. Thank you so much for inviting us to give a brief country update on Germany. And thank you so much to everybody for the outstanding presentation we already have seen today and organizing this transatlantic dialogue today. I try to share my screen with you.
We can see it, Tim, no problem. Please make it presentation mode.
Okay, are you familiar with this, Oliver?
Yes, please hit the little button at the bottom of your screen, which is, yeah, this one.
Here you go. You got it?
It's not coming through. Tim, you know what? I suggest that you continue anyways. I think we can see it clear enough, I hope. Now you have unshared. We can't see it again anymore. Please reshare.
Can you see it now, probably?
We can see the slide, but not in presentation mode. But I suggest that you go ahead anyways.
Okay, we do it like you suggested.
Yeah.
Let's go for a brief outline. Did you see this next slide already? The need for heat health protection in Germany?
Not yet. Please click on the next slide.
Okay, I have to change.
Now we can see it. Please go ahead.
Let's make it a little bit more visible for you. Of course, Germany is affected by rising temperatures, as every country in Europe. And I like to highlight just the issue that Germany has already an aged population, so addressing a lot of vulnerable groups by age, and of course a lot of additional chronic diseases, making our population in Germany vulnerable to rising heat and heat wave events. Of course, you mentioned it all. We do have a federal constitution, so we have a federal level, we have a federal state level, and we have the district community level that already is engaged on tackling heat stress in Germany. So what happened? A smart outline. I think in Europe, the 2003 heat event in France is kind of a milestone of awareness of heat stress all over Europe. And so Germany set up the very first early warning system in the year 2005. And due to the outstanding work of my colleague from the Ministry of Environment, we already were able to translate the WHO guidelines on heat health protection into Germany. But, and this is part of the story, we need to do a better job to bring it into a broad practice all over Germany. As you can see, just a few country districts and community are using heat health protection. In the year 2023, our Ministry of Health started a heat health action plan addressing especially the heat health and the health services. What are the four main objectives of this initiative? These initiatives were first concentrated on putting the heat wave early warning system, the meteorological heat wave early warning system, into public awareness. We had to start to record our heat-related morbidity and mortality. And of course, we started campaigning heat health education and protection, especially addressing the vulnerable groups in Germany. The fourth point is to establish ongoing process of heat health action planning in Germany, following the French model, and of course the PDCA principle, which I would skip at this part. What are the first results we've seen in Germany? Of course, I'd just like to highlight the work that is done by the health services itself. It's especially mentioned the nursery homes, is especially mentioned the hospitals, and especially to mention the general practitioners. We have not talking about the impact of heat stress on the health service in particular today. So as a general practitioner, you have to take into account what you have, especially to deal with medication on like diabetes patients and so on. So you have to raise an awareness for all doctors in Germany so that they can adapt their practice in medicine guidance, and also being a multiplicators for heat health education, like drinking, like doing no work outside, like protecting themselves, protecting people, especially vulnerable groups, from heat stress. In 2023, we had these first results, and we started our PDCA cycle on heat health action planning. After summer 2023, we had a federal heat health conference, rereading all of our heat health action in summer 23, and also looking on what other measures should be taken into a place next summer. So at the beginning of 2024, we were able to release a roadmap for heat health protection in this summer. Some just selected initiatives of our ministry. I just like to highlight one. We focus on communication, addressing vulnerable groups like elderly, like people with severe chronic conditions, but also addressing homeless people that mostly have no real heat health protection at all. In this spring, we conducted a preparedness check, so that we checked with our people, with our stakeholders, with our colleagues from the other ministries, what is the status of preparation of our heat health protection measures. And we had a conference at the end of May where we all come together just to highlight the changes for heat health protection in summer 2024. Especially to mention, we are hosting the European Championship on soccer this summer. We have a lot of guests from all over Europe. Welcome to everybody. And of course, it could have been a real heat stress tournament, but fortunately, in this terms, we are having cool summer conditions up till now, and it should be the next week a cool condition in Germany. We started our summer measures with a nationwide heat health day. And this day I like to highlight because it's not a day that is organized by the Ministry of Health or any other ministry. This is something which is brought up by our civil society, supported, of course, by the ministries, and of course supported by our professional healthcare service structures like Health Insurance, Association of Doctors and Hospitals. And of course, we're waiting for summer 24 just to start putting our measures into place. Oliver, you mentioned we had just a cold summer, but the very first heat warning we already had last week. Let's focus a little bit on what's going on with campaigning in Germany. Of course, we always tackle with our language. We never made a slogan, a claim like "beat the heat," like the UK did. But we have a claim that can be translated like "don't give a chance to heat," or "don't give heat a chance." What we did this year is we had a real old school postal mailing addressing more than 11,000 mayors all over Germany, and the result is quite good because the look and feel of a postal mailing highlights the awareness of heat stress on community level. Of course, we have a kind of free for use and customizable media available online. We use social media campaigning, and of course, we have a collaboration with UEFA during our soccer championship that is also put into place for this special event. Finally, let me please summarize and give a small outlook. For everybody who likes to share experiences and who wants to get started, the German lesson is it took us at least 1 year to establish a process like this. Success factors to be mentioned is, of course, you need a high political prioritization on the issue. What you have to do, especially like a federal country like Germany, you have to focus on collaboration and shared responsibilities. And we suggest at a starting point, just focus on selected measures to raise the awareness for heat health protection and embedded this first starting point in a ongoing process of enrichment of other heat health protection measures. What we'll do, of course, is following the PDCA principle, we'll have a status conference in autumn this year. And what is another big step for us is that we can integrate a heat health protection strategy in our general climate change adaptation strategy on federal level. This is so important because we can better link heat health protection from the sector of health with other sectors, so bridging the silos, like example to urban planning and other resource in our government. In a further time of line, I'd like to just mention that we are planning to have a national civil protection disaster management experience exercise on heat and drought, including all federal state levels. By the year 2026, we will have advanced national heat wave early warning system by the year 26 as well. And of course, Oliver and everybody at WHO, we're looking to adapt your new recommendation on heat health guidelines, I think at the year 26, 27. So thank you so much for your interest.
Thank you so much, Tim. This is quite impressive work happening in Germany. There are a few recurrent themes across all presentations so far, like attention to vulnerable groups and the need to have targeted communication packages to them, the need for early warning systems as well. But what I quite liked in your presentation is also the emphasis on working with doctors and medical institutions and to make them aware of the effects of heat and also capacitate them to be kind of educators for the general public on how to behave during heat. I think this is a very important ingredient. And I also like very much of what you call the Heat Health Conference, basically learning from the experiences in 1 year and then improving in the measures and the interventions in the next year. So I like that stepwise learning over time in managing the heat. Thank you so much, Tim, for sharing these many experiences. And you may want to have a look at the Q&A, Tim. There is a specific question for Germany from Ross Thompson, and you may have a look and provide an answer to Ross if possible. Thank you so much. Now we take the boat back to the other side of the Atlantic. We are going now to the Caribbean, and it's my great pleasure to introduce to you Nicole Dawkins-Wright, who is the Director of Emergency Disaster Management and Special Services in the Ministry of Health and Wellness of Jamaica. And I understand, Nicole, that you will focus on the unique considerations of a small island development state and the challenges which require special interventions as they relate to actions to relate to heat health. So we are very much looking forward to hearing from you, Nicole. Over to you. Nicole, I hope you could hear me well. In case you do, please unmute and turn on your camera if possible. Okay, Nicole, can I double check if you can hear me? It doesn't seem to be the case at the moment. Now I see you unmuted, Nicole. Can you hear me?
Hi, I'm hearing you. Very present. Good day to all of you.
We can clearly hear and see you, Nicole. The floor is yours.
Thank you very much. Good day to all of you. Do I have permission to share slides?
Yes, you should have permission. Please share your slides.
Thank you very much. Let's see if I can get into slideshow mode. I'm beginning. And if you can just confirm the audio is good and visual is good.
Looks all perfect. It's all
Okay, thank
yours.
you so very much, and thanks for your patience. I first and foremost want to thank the organizers for having me participate in this very important transatlantic initiative and this dialogue on a very significant issue for us at this time. Whilst we're talking about heat, it's about one of the manifestations of our warming climate. And I am going to say to you now that I'm right now in response mode here in Jamaica as we prepare for the passage of Hurricane Beryl. And so I'm a little bit distracted, so you will forgive me, but we do have multiple issues, which I hope you will appreciate when I finish the presentations. So good day to all of you. And I just want to put into context what we're talking about, Jamaica being a very small island state in the Caribbean, and so it does have peculiarities. Jamaica in particular is a very mountainous country, so there's a lot of variation in our microclimate. So in the context of the subject that we're discussing in terms of heat, there's a lot of considerations at the local level where people sit. Most of our population and our development occurred along the coastline, which is experiencing significantly more heat. And our economy is largely dependent on tourism, of which a tourism product is our sea, sand, and sun, and something that may be coming to bite us now in the consideration of a warming climate. So just briefly, I'm just highlighting what I think are three critical topics in terms of the discussion, what we are having to face with in the country, recognizing that heat and heat stress and exposure is significant, what is in place now to go towards formalizing a heat action plan, and the challenges that we are experiencing with that heat action plan. And so in terms of our experiences, what our data currently have in terms of tracking the environmental situation is really in the context of our temperature monitoring. We have 9 weather stations across the island. The most clean data we have right now for today's presentation is from the 6 weather stations that we have. And if you can just take a look at the slide, on the left of the slide, you see the data and how graphically it's representing and confirming what has already been presented, that Jamaica, like many other countries in the world, is experiencing warming. It's very consistent. This is data for the last 30 years, and it is definitely up. And what our climatologists have indicated is that we are already at and above 1 degrees C for Jamaica now in the last year alone, and we are anticipating this to be worse. What is even more significant as well is that this warming is occurring more so in the evening or in the nighttime temperatures, which means that the country as a whole and the people exposed have much less cooling down periods during each day. And so the matter of chronic exposure to heat is becoming even more significant for us. The other particular consideration is that in keeping with our developmental progress is that the population is becoming a lot more urbanized. And you can see the graph to the top right of the screen. It is happening at a much faster pace than in previous decades, which therefore means that we have an increased exposure to the other potential factors that lead to heat stress. And that is the matter of our urban heat island effect on the exposed population. Additionally, as well, we also are having aging population. And so we have a lot more of the proportion of our population that are in the 65 years and older age group, not to mention the increasing or the lack of control that we have in terms of our non-communicable diseases, which of course increases our vulnerable population. The bottom right graph is really a picture of the admissions over the last few years that we've looked at. In Jamaica, we haven't actually tied the two things together. And what we're seeing is that in Jamaica, we do have a heat season that runs from May to October of each year. And there seems to be a pattern or a correlation between the admissions to our public hospitals and this heat season. But whilst we have not confirmed it for our local or sister islands in the Caribbean have already actually demonstrated that when temperatures go up, there is in fact an increased pressure on our public health system, and therefore this is something that we have to keep in mind. So recognizing that there is an issue, the Ministry of Health and Wellness and as the lead agency for driving activities in both the public and private health sector, there are some activities that have allowed us to put us in a better position to formalize and institutionalize what needs to happen in terms of our response to the increased exposure to heat stress and heat strain. So it is seated in our existing institutional framework, one of which is our climate change policy framework, which has been promulgated for some time, which gave rise to a climate action and health program within the Ministry of Health and Wellness that we can seek to bring towards the activities that coalesce around action to support all the effects, including the increased exposure to heat. It sits within our disaster risk management framework, and within that framework, what we have been doing over the period is just providing general sensitization to our healthcare workers for understanding what are the ill effects related to climate change, and focusing a lot more on our infrastructure resilience in terms of adaptation to the issue. We do work very, very closely with our Met Office for the provision of information whenever there's an adverse event, whatever that event may be, including extremes of heat. And more importantly, in more recent time, we've upped our game in terms of activities within the health sector and made our commitment at the launch of the health program at COP26, whereupon we also joined on the attach. It is also important to note that we are taking steps to empower our healthcare workers by introducing a module in the training curriculum for both medical officers and nurses. And just last year, we also would have conducted an evaluation in terms of the exercising of the system and recognized the need and the need for contingency plans specifically for increased heat exposure. Also of significance, because we do recognize that anything related to climate is very data-driven, is that we have now been able to successfully integrate the subject matter of climate change and health into our National Health Research Conference, which the Ministry of Health and Wellness hosts on an annual basis. And we're now making progress in terms of being able to provide integrated weather, climate, and health data with capacity that has been built with the Met Office and our strong relationship that we have with them. That puts us in a good place, because the other thing that came out of the climate change policy framework is a regular evaluation of the state of the Jamaican climate report, which has been published and now in its third iteration, which is providing information for resilience building for the key issues surrounding the matters of climate change. So we do know that based on the availability of data that has been provided from the capacity that has been built, the findings in terms of our current situation has been well documented and very structured and can stand up to scrutiny, and the projections are indicating that this is likely to continue in accordance with the global trend, being worse, not as significant in the coastal region, but more so in the interior region. And so the third thing, which I think is important to highlight, is the strengthening specifically in the subject matter that we're discussing right now, and that's the matter of a heated early warning system for our population. So we were very fortunate to be the beneficiary under a project with the support of the US Prepare, in collaboration with our Met Office of Jamaica. And as mentioned earlier in the opening remarks, we did in fact host the Caribbean Regional Workshop, whereupon we would have strengthened some good partnerships and networks, and Jamaica is to benefit from one of the additional activities in terms of capacity building, which we're working together to strengthen, both from the health side as well as from our climatology team members. We have already started some of the outputs from that work, and that is the experimental Caribbean Heat Health Early Warning System, early alert bulletin that is to be incorporated at the national level, and we're working with our health protection and promotion and our epidemiology team to contextualize that for our Jamaican context. The fourth thing, which I think is probably the most important thing in terms of driving what needs to happen in allowing Jamaica to be better prepared for the increased stress, is the matter of our external and key stakeholder consultations that have been had. So through last year in 2023, we would have expanded that climate change and awareness program to diversify the people that we actually engage on that regularity. Last year, our focus was on the farming community. We have expanded into our community level organization, our civil societies at local level. We are almost at the completion of the consultation process for the development of Jamaica's health chapter of the National Adaptation Plan, whereupon we emphasize that one of the first things that needs to come out in that first iteration of our adaptation activities is to focus what needs to happen in terms of the heat stress that we're now recognizing as a matter of the most urgent things to address. We have also had very, very critical and important dialogue with our local government, the Ministry of Local Government, which is responsible for urban development. And so that is going to be very instructive in terms of how we seek to town planning and how we manage cities and settlements within the country. And our Water Resources Authority would have had a special engagement as well as it relates to the availability and distribution of water. So those are key, but it's not without its challenges, and that's what I'm hoping to emphasize, that despite the awareness challenge, there is still a very low level of understanding amongst the key players, which must push this activity forward, as health must lead in the argument, but our healthcare workers are not as au fait as we would like them, and so the empowerment at that level still has much to improve on. There's also another issue in that as a diagnosis, heat illness is not one of those things that we tend to capture in our accident and emergency departments, where persons would tend to present. So we really have no idea as to the burden of diseases that we're seeing related to heat health. And so that is a whole set of development that needs to happen to gather the health data to support our input. Because of that, clearly there's insufficient local research that can tailor our contextual information for the action in country. And that being said, we also don't have sufficient standards that can be tailored to our local context that will inform the public health initiatives that will be required. All of this is happening while we're having an increased exposure to our vulnerable population, the matter of chronic heat that I mentioned earlier, a booming informal sector that is expanding, particularly our outdoor workers, our construction workers. We are also having an increase in the number of sporting activities for persons to be exposed. And as mentioned, we do have an uncontrolled NCD epidemic. So our vulnerable population groups are becoming increasingly more burdensome. As it stands right now, we do not have a proper or adequate data sharing mechanism as it relates to weather and climate data for health outcomes. And so that's something that really needs to be strengthened. And so we're not in a position to structure our response mechanisms, even though we do have, in fact, regulations to support building codes, but it does not factor the matter of cooling, because this was not exactly presented as a matter that needed regulation at the time. So there is a lot of work that needs to be done to protect our population, and it's going to be very difficult unless we can find a way to ensure that all these these actions that are required happen consecutively so that we can get the impact to protect our population. That is my presentation from Jamaica. And I hope it kind of provides some of the context that I hope will be considered in this transatlantic dialogue on heat health. Over to you, Chair.
Thank you very, very much, Nicole, for you sharing with us of where Jamaica stands at the moment with heat health action planning and taking action. It was a very rich portfolio of experiences, confirming many of the actions that we heard already from the other speakers previously. I'm not going to repeat that, but I think what you highlighted particularly is also the close link to the disaster risk management agenda and also institutionalizing the actions on heat by bringing all the stakeholders on board. You have made nice progress already, but also highlighted that more needs to be done to share, that everyone can play the role that need to be played in the complex of responding to heat health. And I personally also very much like the link to the water agenda, particularly in areas where water, the scarce resources are stressed already with increasing temperatures. This is adding to the problem. And we saw also a few comments here in the Q&A in this regard. Thank you so much, Nicole, for sharing these very precious experiences. Now we are now coming to the final presentation in this segment of the meeting. We are now going back to Europe, to Spain, beautiful Spain. And we have with us today Hector Tejero, who is the Senior Advisor on Climate Change and Health at the Minister's Health Cabinet in Spain, obviously. And Hector, if I'm not mistaken, you will share with us the experiences that come along with the Spanish newly established Observatory on Climate and Health and how heat considerations sit within the observatory. I'm curious to learn more about this. Over to you, Hector.
Okay, let me share the presentation. Okay, so I will talk about these two things. First, the heat health action plan in Spain, and then this new kind of organism we have created, the observatory. So Spain is is the most vulnerable country in the EU to climate change, and we have a lot of sorry, I'm changing things here. So we are aware of the risk of climate change in our country, especially heat. So we all know, as previous speakers have said, that only a small part of heat-related mortality is due to is diet. Most comes from the mortality attributed to high temperatures because of disease that are make worse by heat, and this is the actual numbers in Spain of mortality and morbidity. We have about 25 deaths by heat stroke or excessive natural heat exposure. But we are very worried because we have these numbers of 3,000 or 4,000 deaths related to high temperatures, especially in old people, which is the most vulnerable people, not only because it's chronic disease, chronic patients, and a lot more. And then we also have a new study of how heat impacts in hospital admissions, and we see one research group in Spain has observed a 10% increase in hospital admissions in general when there are high temperatures in the summer. But for some specific diseases like metabolic disorders or related to obesity or renal insufficiency, we have cycles of 90% increases or 70% increases, which suppose a very high tension for the National Health Service. So, well, as a lot of countries that have Canada or Germany, Spain also has a national health system with shared responsibilities between the central government and the regions. We have a very highly decentralized health system. We usually talk about not a single national health system, but 17 different regional health systems. And the role of the ministry is coordinating and keep the systems the cohesion. So basically, in terms of heat, we do the plans, and we have a national heat warning system. But the regions and the city are the ones in charge of implement the measures of prevention with old people, with in the hospitals, in the Center for Care for Old People. So our national heat plan, heat health action plan, was established in 2004. We have working in it for 20 years. It was after the famous heat wave in France in 2003. But the problem in Spain the last year or from the past years is that we actually have like two heat plans. One that is with this Meteor Alert plan, which is the plan of general adverse weather phenomena, including heat, that is put in charge by the Spanish State Meteorological Agency, and which is the most famous web resource when people look for heat warnings and how is the weather or everything, if tomorrow is raining or whatever. And then we have this heat health action plan of the Ministry of Health, which is a specific plan for heat impacts on human health. So basically, what we have been doing this last year, and I don't know if it probably is if interesting to you, is trying to harmonize these two plans. So the plan from the State Meteorological Agency is what we call a daily meteorological thresholds. It uses daily meteorological thresholds by isoclimatic zones. So this is they do heat warnings not by their impact in the health of the people, but by their statistically anomaly. So if there is one temperature which is kind of rare in some region because it's above the 95 percentile, they do a warning. The problem is that these meteorological thresholds are not necessarily related to health impacts. It's something that has been observed in last year. So probably the state weather agency is doing an alert which is not related to health. So last year or two or 3 years ago, the Spanish health minister made a study with some researchers from Spain in order to obtain health impact temperature thresholds. So we have done an analysis, statistical analysis in several regions in different regions in Spain, correlating mortality with the temperatures in order to obtain these health threshold, sorry, these temperature thresholds beyond which we observe a significant greater mortality. So this is the main change, the main change we have take this year. And so our heat plan, as most of health action plans, define risk levels based on an algorithm which takes into account the prediction not only for the current day, but the 2 days after. We define these 3 levels: green, yellow, orange, and red. That's every other country probably. And we have made this health impact temperature, but what we call isoclimatic zones, which are very small regions inside the administrative regions in which we have the same weather conditions mostly all the year. So this made we had the previous problem. Spain is a country with a lot of different weathers. So we had the problem with big regions that if you do an alarm in a big region like a community or a province, as we call here in Spain, the north part of the region was not. They don't have the conditions from given a heat wave, but the south part they have, or vice versa. So we have done a lot of work in order to make a more granular approach to these health plans. Sorry, heat warnings. So the main idea we have in this plan is that health impact thresholds are highly variable geographically, and this is something that we have in Spain. We have basically two big weather regions. The south has been traditionally like very hot, similar to like the classical Mediterranean region, but the north of Spain is not similar to the north of France. It's more a kind of Atlantic weather region. So we have and basically we have the problem we have in these usually colder regions, which are now experiencing more heat due to climate change. So we have translating this message to the population that is not about that 40 degrees, and this is something the main newspaper in Spain, which we have been a lot of work to translate this message to the population that in different regions of Spain you have different heat thresholds, and you can have like 24 degrees in one north region. You have it's a risk for health risk, but for the south of the Spain we can have 38 or 40 degrees, and we don't have health risk. And this is our last campaign from this year. We have, and I am not going to introduce to go into the details. And we have, but I do want to emphasize this: the last of the advice, which is remind them. We are putting a lot of stress from people to take care of other people because of heat. It's going beyond this individual approach of take care of yourself and going to a community approach of you have a moral duty to take responsibility from other people, especially if they are vulnerable people. So about the Climate Change and Health Observatory, this is one interministerial coordination body between the Ministry of Health, but also the Ministry of Ecological Transitions, the Environment Ministry in Spain, and also the Science Ministry. So we are working from these 3 ministries, and our main objectives are kind of coordinate all the recommendation of public policies to reduce the health impacts of climate change, and not only from a health point of view, but also from a urbanism point of view. What should cities do to reduce the health impacts of climate change? We are working for develop this health risk warning system. Improve going to the individual level, and we are very interested, and some speakers have also talked about it previously, in promote a better communication of the relationship between health and climate change, and putting the health professionals in board. So we have developed these working groups. The first one is the extreme temperatures group, which is related. Its task is to update and improve the health heat plan, and we are going to improve every year. Second, this communication and training group, which is our idea is to think with professionals of communication and from the media, from the weather, for example, the people who do the weather in the news, but also with people from representatives from the health professionals, doctors and nurses, how to communicate better the impacts of climate change in health. We know that in Spain, every day, the doctors do 1 million of medical advices. So if we can translate in this, if we can do that, these health professionals also do climate-related advices, this will be a very powerful messages. And then we have these two groups. The first one, the last two groups, one related to the occupational health and climate change, because this is a very different issue from normal public health issue, because workers, they don't usually can decide their work situation. So this is something we have to talk with unions and the entrepreneurs and the firms and whatever. And then our last group is we need to study which are the climate change impacts on the mental health of the population, especially the young ones, or especially when they have been some extreme events in some region, in some village with some wildfire, or they have with a drought or whatever. And finally, I wanted to show you the kind of adaptation model which we are working in the observatory is this concentric circles approach, in which we put the individual self-protection in the center. Is something we are working with, and working with the warning and alert systems and the individual advice. People have to know what they should do and when they have to do it. But we are very interested in this community approach, taking into making all the communities take charge of heat, the caregivers, the prescribers in the community, in the media, wherever. Also, making a lot of stress in the responsibility of people with other people, and we want to develop what we call a heat culture, which is that people have some kind of healthy habits related to heat. And finally, we also we are in this ministry, we have we do a lot of, we're very aware of the social and environmental determinants of health. And so we want to also talk not only about individual adaptation and individual self-protection, but also what about healthy cities? How do we make more green areas, and how it's especially in low-income neighborhoods? Also, we have how to reduce the urban heat island effect within Spain is very, very, very powerful, and how to develop climate shelters and all the things for people with low income. And that's all I wanted to talk. Thank you.
Thank you very, very much, Hector, for sharing this rich experience from Spain. Let me sum up 2 points that I observed. This is by no means complete, but resonated very much. I like very much that the thresholds are variable across the country, depending on geographic conditions, but also the responses will vary. And therefore, it's important to work with regions and municipalities in a close way in order to have tailor-made analysis and responses to the heat. And I think the second quite nice, outstanding feature is the observatory and the work that you are starting under it. And I really love the establishing a heat culture among the stakeholders. I think that is a very, very important point, that we all need to learn to live with heat and ingrain it, so to say, in our behaviors in a way.
Yeah, actually, in a minute, what we see is that, especially in the south of Spain, which is hotter than the north, they do have actually a heat culture. And what we want is to move the people from the north of Spain has to learn the heat culture for the people from the south of Spain. We have years of experience, because they have experienced a lot of heat waves in their lives, but not in the north, because there was a colder weather.
That's really great. I'm very keen to learn more about this, but I'm afraid we don't have the time to do this today. But this is also a nice follow-up later on. So with that, I would like to conclude this session by thanking once more all 5 speakers for sharing these outstanding examples on the ongoing work in responding to heat. But I'm not concluding it without mentioning that there is quite a lively lively exchange happening in the Q&A space, with several of the questions already answered by colleagues on the call and a few more which are open that we are going to address. You may have noticed that we are slightly running over time, and thereby I encourage all the panelists and all colleagues of WHO to pay attention to the Q&A segment so that we can also properly reply to what is coming up there. And I see that colleagues are already vividly responding to the questions. So we will keep on using the Q&A space to formulate questions and to respond to the issues coming up. With that, I would like to conclude that very session on sharing country experiences and would like to invite you all for a 5-minute comfort break. Please be back in 5 minutes, and we will continue, so to say, at 17:17 of Central European summertime, and which is equivalent, I understand, to 10:17 a.m. Sorry, 11:17 a.m. In the Americas. So 5-minute comfort break from now.
Hello, everyone. Welcome back. Hope you're hearing me clearly. We had a very lively and interesting first 2 sessions of this dialogue. And so we're going now to session 3. I'm Karen Polson Edwards. I'm the advisor for climate change and health with PAHO in Washington, D.C. And I'm joined by my colleague, James Creswick, who is the technical officer in the WHO European Center for Environment and Health. And we'll co-moderate this session, looking at lessons learned and opportunities for capacity building and strengthening collaboration to address heat and health. And we're just going to make a slight change to the agenda. Apologies all. We're going to start with the US of section first, and then we'll go over to Europe. Due to some commitments some of the panelists have, we have to make that adjustment. So apologies, please. So we heard from John Balbus earlier in the opening remarks from the US Department of Health and Human Services. John, I'm not sure if you still want to come on now and say something before we go in to the rest of it with the team from the US.
Thank you so much, Karen. For in the interest of time, I'm really delighted to have the 2 colleagues I mentioned at the beginning, Hunter Jones from NOAA, our Oceanographic and Atmospheric Administration, and Candace Falsing from USAID. So I think we can just turn straight over to them. Thank you.
Thank you very much, John. So over to you, Hunter. So as John said, Hunter Jones is the program manager from the National Integrated Heat Health Information System, NHHIS, from NOAA Climate Program Office. And I'll ask Hunter to speak to some of what is being done on the domestic scene in the US as it relates to heat health. Over to you, Hunter.
Thank you very much for the opportunity to talk to this this wonderful group that you've assembled. And hopefully you're seeing my screen properly. For the most part, I think you might be also getting the browser window, but it might be the best I can do with the Google Slides. So yes, while I am at NOAA, I work on the National Integrated Heat Health Information System, which is a collaboration across 25 agencies of the US federal government. And John is one of the co-chairs on NIHIS, as well as a handful of others. And so what I'm going to share really briefly is what we've been up to and some of the ways that we've learned to work with our colleagues at the state, local, tribal, and territorial levels, outside of the federal government, as well as a little bit how we managed to work together among ourselves as well. Let me start out with the obvious. As many have already shared, we know that heat is a present and growing risk. We know that the impacts associated with extreme heat are many, not just health, but a lot of other things too, infrastructure, et cetera. So what I'm showing you on this slide is just how one of the ways that we are keeping track of this issue in the US. So we have heat.gov, which is a shared federal resource. It is managed by NOAA, but it is meant for all of the federal agencies. It doesn't displace any federal agency heat website or information, but it is a good starting place for anyone who wants heat information associated with the US or beyond. And so what you see here on the left is the main screen of heat.gov, and it's showing the new heat risk tool, which was co-developed by CDC and NOAA, and is essentially a categorized heat early warning system that is tuned to health impacts, tuned to mortality and morbidity. And that's why that collaboration was so important. A lot of other information on heat.gov if you've never visited. And this challenge is getting worse because, as you can see on the right, the National Weather Service, which is part of NOAA, has to issue more and more heat warnings, advisories, and watches every year. And so we see those ticking up. So in order to really address this problem, one of the fundamental challenges we saw is that people need to take heat seriously. That is, of course, increasing quite a lot across the US, but everybody needs to be able to understand their own risk. And one of the best ways to do this, we found in the US, is to work on community science or citizen science projects. And so NIHIS has, over the past 7 or so years, worked with over 80 communities to run urban heat island mapping campaigns. We equip volunteers with sensors that they can attach to cars or bikes, and they take measurements of temperature and humidity in their own neighborhoods. And those are used to produce the maps like you see in the third panel here, which is a really nice integrated surface map of the air temperature and heat index. So not just surface temperatures, but actual air temperatures. And doing this as a participatory approach has really allowed us to talk not only to community-based organizations and others, other groups that maybe governments don't, the federal government doesn't typically interact with as much. It's helped us get a much larger picture, a much more richer picture of heat impacts on the ground. It's also led to a lot of outcomes. So we've learned that these sorts of engagements, and it's not just NOAA, it's a lot of NIHIS partners that are doing these engagements with us, have led to awareness and advocacy, journalist coverage from local to national to international, community engagement, as I mentioned. The data from these projects has been used in resilience planning and grant making. It's been used to inform where smart surfaces go and urban greening and a lot of other approaches too. So that sort of hands-on approach has really served us well. Another thing that we've done with communities is run tabletop exercises. These are exercises where you develop an extreme heat scenario and you game it out with participants in the room. You sit down and you talk about what would happen and what would the impacts be, and how would your organization or your agency deal with this, and what are the gaps? And so we've had these conversations in a handful of US cities, and we're trying to scale that up as well as we go forward. And we've captured that experience in a new guidebook that is now on heat.gov and available for others to use to run tabletop exercises. Similarly, something we learned from those exercises is that a lot of governments are still grappling with heat governance as a topic. And so what does it mean to have your state government or your local government working on extreme heat? How do you organize that? Who is in charge? Who is accountable? These are questions that are addressed in this maturity model, which is a series of 10 different things that governance can be scored on. And based on the levels you're at on those 10 different criteria, you can determine how you move forward and advance your maturity. And you can also compare yourself to other communities to see if you might learn something from some of your peers. Again, building on all these experiences where we've learned how to engage locally, we also determined that there's a lot of interest still in doing that collaborative monitoring approach, the citizen science approach that I mentioned. So we launched a center focused on that, which will continue to scale up those activities and take applications from communities that want to do these heat mapping projects, and a center for heat resilient communities, which is focused more on the policy angle. So how do we scale up those tabletop exercises and those governance models that I mentioned before? So those are some very specific examples of how we've learned to collaborate more with communities, but this is now zooming out all the agencies that are part of coordinating federal heat action with NIHIS. And so you can see at the top the types of activities that the federal government engages in to address extreme heat. And then at the bottom, just a little bit of information about the fact that we've been around since 2015. NIHIS has been active for quite a while, and it's taken a long time to build up this interagency approach, but now we're a really robust set of agencies that are participating. Really quickly, a few other things. The NIHIS program is also developing a shared national heat strategic plan, which will be rolled out later this month. We have resources. I've already shown you heat.gov, but there's a newsletter, there's a X/Twitter feed. So we're trying, and a lot of agencies are part of that as well. And then we also have an annual meeting called the NIHIS National Meeting, where we get together in April, just in advance of the heat season, to talk about extreme heat. We work on a lot of tools. I've talked to you about some of these already. So I've talked to you about the heat risk tool. I want to share with you also some additional tools. On the left, NOAA and CDC collaborated on this monitor that shows recent temperatures and the rate of heat-related illness. We also have in the middle the HHS Climate and Health Outlook, which I will admit I think was partly inspired by the Caribbean Climate and Health Outlook. So we took a page from our partners down there. You've done a really good job with that outlook, and we wanted to have some of that excitement as well. And then on the right side, a new product, the Heat and Health Index, that was released by CDC, that pulls in data from census, from NOAA, from CDC. So these are shared products that agencies are developing together. And then finally, we also have agencies working on their own internal processes. And so we have agencies like FEMA and DOT that are streamlining benefit cost analysis to make it easier to get resilience funds. We have already heard a little bit about, hopefully you've heard a little bit about OSHA's heat rule that they're working on. I know the White House had an announcement on that earlier today, and a national emphasis program that's allowing them to do heat-related inspections now while they're developing a heat rule to protect workers. And then on the end of the slide here is the Housing and Urban Development also working on an extreme heat quick guide. So a lot of agencies are putting together resources for their partners and their grantees. I will end by just saying we would love to stay in touch with all of you, and you can reach out to us via these various mediums. Thank you for the time.
Thank you very much, Hunter, and thank you for sharing with us what NHHIS has been doing so far on the national scene, and also bringing to fore the importance of including citizen science, the citizen science approach, and you know, reminding us that we have to understand our own risks. So thanks for sharing. Thanks for also sharing the resources and the tools and the excellent example of, you know, the fact that we are already sharing with each other using the climate health bulletins. I know our colleagues are very happy about that. Before you come on, Peter, I'm going to go just to stay on this side with the US. I'm just going to ask Candice to go ahead first. Right, thank you. So Candice Valsing is the Senior Advisor for Climate Change at USAID, and Candice will tell us a bit more about what's happening in terms of the international scene and what's the work being done there. Over to you, Candice.
Thank you. Good morning, good afternoon, everyone. I'm trying to share my screen. Are you able to see it?
Yes, just put in presentation mode and you should be fine.
Okay.
Just go, if you go bottom right.
Oh, here it is. Okay.
Yes.
The people are okay. So good morning. Did that work?
It's swap the screens because we're seeing your notes. So swap screen and then should be okay. Display settings and swap screen.
Oh, stop sharing. Sorry, everyone. I will be brief. As you can see, I don't know if this is.
You go ahead as is, Candice.
Okay.
Should be okay.
Can you see
Yes, we see your presentation in the notes.
All right. Well, we'll make through today. So thank you all for inviting us to come participate today. USAID is taking extreme heat very seriously. It's a high priority to our Administrator PAHO. And we've taken a number of actions across the following months as well as years to increase collaboration and the work that we are doing with the countries that USAID missions encompass, which is over 80 countries. So I'll briefly describe some of that work and then would love to identify opportunities to collaborate following this discussion. So as a whole, the US government announced, President Biden and Administrator PAHO, and at that time, Secretary Kerry announced the Prepare Initiative. So this is a cross-government initiative to coordinate our approach to bring together diplomatic development and technical expertise in the US to help reach more than 500 million people in developing countries, to help them manage and adapt. Extreme heat is, of course, one of the many perils of climate change that Prepare covers, but a key one. And Prepare generally has 3 pillars. One is sharing knowledge, the second is plans and programs, and the third is mobilizing finance and private capital. Similar to my colleague Hunter, there's a number of agencies that are involved across the US government in the Prepare Initiative, as well as other collaborators from outside the US government who have partnered with the US on our adaptation finance window. When it comes to USAID as a whole, we work across several different themes to support countries to scale resilience to extreme heat. This is just a snapshot here. It covers infrastructure and urban development, health, helping develop heat action plans, supporting the development of early warning systems, supporting things like drought resilient seeds, and of course, spurring private sector action. So we've been doing this for a very long time, for decades, but recently, at the direction of Administrator PAHO, began to increase our ambition dramatically here. And so in March, we hosted a global summit on extreme heat with IFRC, the International Federation of Red Cross and Red Crescent Societies. In that summit, we brought together leaders from all across the world who are taking low-cost interventions to make their communities more resilient to extreme heat, just to showcase the possibilities that are out there and to increase awareness and knowledge sharing. The president of Djibouti actually keynoted the remark and said, made some very stark comments that if nothing is done, the Horn of Africa risks being uninhabited, which is true of many other, of course, countries across the world. And so just wanted to highlight those dramatic remarks that were made in line with the other comments that you've already heard this morning. At the summit, we also, USA took a few actions to help protect our workers overseas. So we released guidance on extreme heat for federal agencies operating overseas. So this is all of our missions and posts all over the world. This is guidance to help them better prepare for extreme heat to keep their workers safe. As just a quick follow-up to note, as we've been rolling out this guidance and talking to our missions, we've been learning that, in fact, many of the Foreign Service nationals that help support us do need help and are asking for support around extreme heat. They can't sleep at night, their productivity is decreasing, and so we are very much seeing the impacts of extreme heat on the aid workforce. We also released an interactive map to help our missions better prepare for the impacts of extreme heat and identify which missions around the world are likely to be most impacted first. First, we did 2050, and then more recently, last month, we updated it for impacts for 2030 to help them plan more in the near term. And then we also launched an interactive global extreme heat action hub. So this is an area where we are calling on other governments, on other aid agencies, on other multilateral development banks to increase their participation and collaboration around extreme heat. We did the same for our own building, for our own agency, and called on all of our bureaus and missions to take action to protect communities and workers from extreme heat. And this slide just shows a few examples of what we're seeing across the world from our missions. So Manila, they're helping to increase access to high-value heat-resilient crops. Rwanda, Ghana, Zambia, similar things for climate-smart agriculture. Ecuador, helping support the adoption of new standards for air conditioners. Serbia, similar, taking action on energy reduction. And then in Jordan, helping with the development of climate resilient schools that help protect from the effects of extreme heat. So really taking a whole of government and a whole of the world approach to helping protect workers and communities from extreme heat. More recently, and I'll end here, you saw that the third pillar of prepare is scaling and mobilizing climate finance. We pulled together an emergency meeting with Administrator PAHO and Secretary Yellen last week. All 4 presidents of the regional multilateral development banks joined and spoke. It was a very robust discussion on how to increase financing and collaborate amongst ourselves. And also our colleagues in other aid agencies, for example, JICA from Japan was also on that convening. And like I said, there's a lot more follow-up from that discussion. It was only the beginning of a discussion, and there was a commitment to work together in the coming year. And so we are very eager to collaborate with our partners, not only, and obviously the countries where we have missions, like I said, but also aid agencies. So I will put again, trying to be brief, but I will put my email in the chat, and please do let me know if you or your other agencies within your government are interested in collaborating. We're very much taking this seriously, as you'll hear about more later today from our boss. Thank you very much.
Thank you very much, Candice, for sharing the work USAID is doing and the examples of, working with with all the sectors, as you mentioned, the whole of government approach as we're looking to deal with extreme heat. So thank you, John, Hunter, and Candice for taking us through what's happening, what you're different entities are doing in the Americas and across the globe. So I'll hand over to James now, who will take us back to Europe. Over to you, James.
Thanks, Karen. Yes, coming back over to this side of the pond. Actually, Candice has already even taken us beyond the Atlantic in her presentation there, which is also really interesting. And trying to capture what's happening all over the world, I think, is impossible to do in a couple of hours in such a format. But looking now on our side of the Atlantic, I would like to hand over to Peter Loeffler. He works in the Directorate General for Climate Action in the European Commission. And looking forward to hearing how you have been not only supporting us, but also supporting EU member states in scaling up their adaptation to heat. So Peter, over to you. Looking forward to hearing.
Thank you very much, James. First of all, can you hear me?
Can hear you and see you fine.
I'm just trying to share my screen, but I don't see, and I don't know why, I don't see my PowerPoint window here. Ah, here it comes. Wonderful. Okay. Can you see that okay, James?
Yes, we can see it. It's not on full screen mode, which I think is a problem a lot of people are having when they have multiple monitors.
Is it good now?
It often crops up on another monitor, but I think it's big enough. I think we can.
Are you okay? Do I need to swap the screens?
If you swap I think it's probably showing full screen on another screen.
I will do that in a second. Okay, same exercise again. It always happens if you do it with two screens. So, how is that now?
That's it. You nailed it. Thanks.
Okay, wonderful. Okay. Well, good morning and afternoon to everyone, and many thanks for having me. This is really a fabulous exchange. I'm very happy to be here in the room with everyone else. I work for the European Commission, and Europe is not a country, and it's not a United States. It's something in between, but the European Commission is, I think, best compared to something like a federal government. I mean, we do similar things, and so our Climate Action Director General, as he called it, is a bit like a ministry. First of all, let me say that just like everyone else in the room, we are really concerned about the 60,000 plus people that have been killed as part of the heat stress in 2022. The fact that 2023 was the joint warmest year for the world WMO Europe region. The fact that Europe's temperature increases twice the speed the global average, and we are set to head to plus 2.5 to 7.5 degrees by the end of the century. And the warnings of recent Nature papers of statistically impossible heat waves in Europe hitting temperatures in excess of 50 degrees Celsius, something other world regions, by the way, and I'm fully aware of that, have already reached right now, which is extremely disconcerting. To get a more systemic view on the risks which this carries for health, we have just been undertaking, together with the European Environment Agency, the first ever European climate risk assessment, which looks at the climate-related risks for the entire continent. And that risk identified and prioritized 36 key climate risks in all areas. And there was one of those focal areas was health. And within health, quite unsurprisingly, I'd say heat stress was identified as the largest and most urgent risk, both indoors and outdoors. But you will also see on this graph here that there's reference to health systems and infrastructure risks, which may sort of exacerbate the impact of heat health risks, and reference to wildfires, as it's being said before, wildfires and the pollution which comes from wildfires go often together with heat health risks. Faced with these climate risks, the first point I would make is that climate and health policies emerge as natural allies. Ensuring a healthy future and the well-being for all is something that we have as a common goal, both in climate policies and in health policies. And we in the Commission have a very active cooperation with our colleagues from the Health Directorate General. So we work in tandem, and of course we work also in tandem with our international partners in the context of the United Nations and other international frameworks. Now, the first point from a climate policy perspective, which I want to make, and this is where really the key strength of our house is, that we need to cut greenhouse gases down to zero as fast as we can. And Europe was the first world region which committed to become climate neutral by 2050. The good news is we are on track of reaching that. We have just proposed a minus 90% reduction target for 2040. And our assessments, actually all the facts which we also see, is that these reductions and the decarbonization come with very significant short to medium term health gains from less air pollution and reduction of air pollution related mortality. Just yesterday, a major study came out which showed that the the emissions trading system which we have cut the emissions from power plants and the industry by about 40% since the system exists. And the reduction in particulate pollution in the air is worth hundreds of billions of euros in avoided healthcare costs, according to that study. The second point is, however fast we progress on our road to climate neutrality, the inconvenient truth is a good degree of climate change is happening already, and it will continue at least throughout the century. So climate resilience and adaptation are necessary to keep us healthy and well in a warming world. We have an entire EU framework for climate adaptation. I won't go into that, but essentially it aims to make adaptation smarter, faster, and more systemic. So this is our holy trinity. Before I dwell a bit more into this holy trinity, our key initiative, or one of our key initiatives on climate and health, is the European Climate and Health Observatory. This is a unique interdisciplinary and collaborative partnership which we launched in 2021. It counts with the active contribution from major players in the field, including WHO Europe, the relevant EU agencies, and international players. Essentially conceived to be initially an initiative to build and share data, knowledge, and tools. We also engage increasingly in capacity building, training, and education. Several speakers have already highlighted the need for that, and we were very pleased to have a very significant budget increase earlier this year to do that. Now, coming back to this holy trinity of smarter, faster, and more systemic adaptation, and this certainly applies also to heat health. Smarter adaptation, of course, has to do with knowledge and data. On the Climate and Health Observatory website, we provide links to early warning systems of member states and others, such as a meteor alarm system. This is something we don't need to do at the EU level. It does exist already in many places. We do, however, use the data from our Earth observation system called Copernicus to, for example, provide data on long-term projected increases in climatological heatwave days and others. We think this is a good service because the WMO Europe said that about 80% of EU member states provide data services to their health services, but only 50% provide climate projections. So there's clearly a need for this type of projections. Secondly, if we speak about risk and risk data, this is not just about climate hazards. This is about also what's in the way of the hazard, i.e. the exposure and the vulnerability of what's in the way, the vulnerability of sectors and groups. And so, for instance, just to give two examples here, we, together with the European Environment Agency, we did a study which shows that about half of our hospitals on the European continent are in urban heat islands. And that is a problem if you have a major heat wave, because the staff of these hospitals is stressed. Many of them don't have good air conditioning systems. And you also know now from a major study in Portugal that a heat wave increases hospitalization by at least 20%. A second major vulnerability factor is the aging population. It's been said already a couple of times. And so we did sort of a data set which shows the projected growth of exposure of people older than 65 years to heat waves in Europe by country. We also do have major data gaps, and let me maybe say here that our data inconsistencies. We do national temperature regulations in education, care, and work settings are on a country-by-country basis very, very different, and we don't have a good overview on that, so we're working on that. And also heat mortality and morbidity is measured in different ways in different member states, and so we don't have a good figure, really, a composite figure for that at the European level. And again, this is a work in progress. The second pillar, as I said, is faster adaptation. We need to speed up adaptation because we don't have a lot of time. Warming advances fast, and we stay behind. I popped up here just a couple of case studies, which we have published again on the Climate and Health Observatory website. You will see that these focus on cities and occupational health and safety. On cities, 3/4 of the European population do live in cities, or already we know cities are heat islands, and that figure is actually also to grow. So cities obviously sort of are a focal point. Sorry for that. Just going ahead, voila. And speaking of the action at the local level, and of course a lot of heat health action needs to happen at the local and regional levels, we do have another initiative under our research and innovation framework program called the EU Mission on Adaptation to Climate Change. This is essentially a network of 300 cities and regions which are supported by the European Union with counseling, advice, guidance, structured methods, and so on, and research to help these cities and regions to become climate resilient. And this includes, of course, also the important heat health dimension. Maybe a caveat on all these actions, in terms of capacity building. We also know that many of these exchange programs between cities are underused. Many European cities do not know about these initiatives. If they know them, they believe it's too complex. We do have, of course, language barriers. We don't have a unifying language, except that maybe everyone speaks sort of poor English. Local administrations in many EU member states are completely understaffed and under-resourced, and they often see participation in these programs as something like an unnecessary luxury and a reward for employees who've got nothing else to do. This is just the harsh reality, so there is a lot of scope for improvement. Final point, we need to make heat health more systemic. We need to intervene in many different areas. This is not just for the health profession to sort of address. And I spoke about cities. Buildings, I was quite struck by the figure that 98% of the casualties of the Canadian heat wave died indoors. And in fact, not only do most Europeans live in cities, they also spend most of their time in buildings. 80 to 90% of their time they spend indoors. And so buildings can be designed to protect against heat with a low energy and carbon footprint, but this requires a lot of know-how. We've been working on that quite systematically. On the left, you see this boring document is the new, just revised Energy Performance of Buildings Directive with more sort of EU-wide regulation on better cooling systems for amongst other things. Another boring document on the right, this is our guidance on climate proofing of infrastructure, also very important, which we use, for example, for major EU investments in infrastructure to make sure that it also takes into consideration heat health problems. And in the middle, this is the EU-level technical guidance on adapting buildings to climate change. All of that, I think, very important. Final point, occupational health and safety. It's not just people indoors, also outdoors, and we all know about workers who work there in the gleaming sun. In our recent communication in response to the EU climate risk assessment, we have promised that we will step up measures to ensure that workers exposed to climate risks are adequately protected. And this is almost a bit of a warning. We will say, and we can do that as European Commission, we will consider the need for more action when reviewing occupational health and safety regulation, and possibly propose in the future stricter regulations that would then be working and enforced at the EU level. We work again in tandem with the European Agency for Safety and Health at Work, EU OSHA, which launched this year a foresight study on this theme, and which will launch next year a major project to increase climate resilience at the workplaces. On the left bottom, you see also one of several EU-funded research projects on climate and health. And by the way, the EU has the largest, globally, the largest research and innovation fund in the shape of its Horizon Europe framework program, which, so as you can see, we partly use also for that purpose. I hope this was interesting. Thanks very much for your attention, and back to you, Karen.
Thanks a lot, Peter. That was very interesting. Lots of positive responses there. And indeed,
Of course, not Karen.
no, that's no worries. We're co-chairing this session anyway. I mean, obviously we need to be looking at strengthening health systems to deal with the heat, and you highlight there as well that half of them are on heat islands. So yes, there's still a lot of work to be doing in Europe, and occupational health is also an area where at the WHO we're also starting to pay a bit of focus, because it's not enough to tell people just to keep out the heat if that's actually where they're getting their livelihood from working outside. So thanks a lot, and definitely there will be some follow-up on what we've heard from you there today. But to carry on this side of the Atlantic, we now move over to Professor Dr. Vladimir Kendrovsky. He is the Technical Officer for Climate Change and Health at the Regional Office for Europe. And Vladimir, you're going to give us a bit of an overview of the work that we're doing to update our guidance on heat health action plans. So over to you, Vladimir.
Thank you, James. I'll try to share my screen. Can you see it? Yes, perfect.
Perfect. Full screen. Yeah.
Okay. So we heard from previous speakers that our region has experienced an unprecedented rate of warming in recent decades. So the number, for example, of extreme weather events has increased by a factor of 5 in the region over the past years. And the 10 warmest years on record for Europe have all occurred since 2007. And the 3 warmest years have all occurred since 2020. We heard from Peter that in 2022 summer, we registered 61,000 dead, but also between 55,000 and 72,000 more deaths were estimated each summer in 2003 and 2010 due to the heat waves. And the heat waves become more frequent and severe, causing significant increase in illness and deaths in our region. So unfortunately, there are no good news for the future, because it is projected to increase, the heat waves to be increased in the future. So that's why we need to provide some guidelines. And since 2008, WHO Europe recommend countries, regions, and cities in the region to develop and implement heat health action plan to prevent, to respond, and to contain heat-related risk. So I will also highlight, this is a process we started in 2008. Now we are develop the update heat health action guidance, our second edition, because based on the updated evidence for effective prevention, or as we call the Book of Evidence from 2021, there are a lot of epidemiologic evidence and experience from the survey from the country which implemented the heat health that we need to update based on the new updates. So in our region, we have 21 member states with heat health action plan who developed one, and a few started very early, but we have a newcomers, new development like Tajikistan in 2023 or Turkmenistan 2022. So in fact, what we started here, the development of the updated second edition, this will provide the evidence-based point of reference for national and local government to establish their own plans. So this is based on the 8 core elements that have been identified so far for the successful implementation with the working group. You can look the expert from our meeting just recently. And we also need in this edition to strengthen the link to general preparedness framework. And this is something which is very relevant to the governments to present. Also, the second edition will enhance integration with broader preparedness strategies for health, heat health resilience. In this, it will emphasize the clear communication on climate change and heat responses, to the better strategies, and the updated public health advice will provide the crucial guidance for managing heat-related health risks. So there are some specific intervention in the local level we intend to provide with updated public advice, which will be in annex of this new updated guidance. So this is very important. And it is based on one of the political commitments, which is very specific in our region. Last July, during the 7th Ministerial Conference on Environment and Health, the new Budapest Declaration by enforced, where countries commit to do a lot of action on climate change and health. And one of the main commitments was developing and updating on heat health action plan as a part of this bigger portfolio on climate change, biodiversity, and environmental pollution. So our office in Bonn, our WHO European Center on Environment and Health, leads this process in the region. And recently we like every year, publish our Keep Cool campaign, which is yearly call for action for people to prevent from the heat health, from the heat. And it is a portfolio of videos, flyers in 20 plus languages from our region, which provide a lot of basic information, and the countries can implement based on their specificity. As was mentioned last year, in our region, we declared the climate emergency on extreme weather and heat health in particular, in order to respond to more efficiently to the request to the countries. But this year, we also promote, as James highlighted, the importance of being in summer season as and enjoying the summer in leisuring, but also doing the sport, but taking in consideration all public health advice. So taking in consideration also that we have ongoing football championship of football in Germany, and forthcoming Olympic Games in France. We also provide some advice for this mass gathering. With this, I'm finishing, and I invite if any question to ask on my email. Thank you.
Thank you, Vladimir. So that brings this session to an end. We have heard how we can strengthen collaboration through the European Observatory and looking at strengthening capacity in our countries through the development and enhancement of the WHO guidelines on heat health action planning. So very much thank you from this side to Peter and Vladimir, and thank you to Hunter and Candace from the US for their contribution to this session. I would now like to hand over to a slightly streamlined closing, because we appreciate that it's already 6 p.m. on our side and around noon on the East Coast, that I would like to now hand over to Daniel Bus and Francesca Racioppi for a joint wrap-up. Over to you.
Thank you, James, and thank you everyone for attending this session today. We had a fantastic lineup of panelists and participants as well. I have to say that we heard here from 6 countries directly: USA, Canada, Jamaica, North Macedonia, Germany, Spain, but we heard many other experiences by the support of EU, WHO, Euro, USAID, and others. So it was a truly learning experience and hearing experience for us. And we heard from the chat, and I invite you to take a look at that. Many countries also reacting to that and sharing some experiences, like Grenada, Argentina. They said it's in the chat. You can scroll up to see that they shared many of their results as well. They are doing an amazing work on heat and health in Argentina. So I invite you to take a look at that. Cuba, Ecuador, and many other countries have commented and left messages. We had the participation of representatives from at least 45 countries. So that was an amazing participation. So thank you so much for spending the time and learning and sharing your experiences with us. The idea here is to have this, to hear how you countries want us, PAHO and WHO, to support you on tackling these important issue, but also we're going to have a series of dialogues that continue on this topic. So very briefly, what we heard here that I took notes of is on the early warning system that triggers early action. We need to make sure the health systems are well prepared for all this information that is coming. We need to work on healthy households and indoor quality and tailoring the information to culturally appropriate scenarios and working towards clean, healthy, and sustainable municipalities and households. And that's really important to protect the ones that are usually affected by compound effects of poor air quality, heat, poor wash services, limited access to health services. So we really need to pay attention to those who are being affected the most, who are usually the same persons who are being affected by these compound effects. We do have many guidance materials. I won't go into details right now, but please reach out to listen, to hear more, and to exchange more information. We are tailoring all these dialogues to prepare summary for policymakers, but also especially to create networks through PAHO, through WHO, through HHS, but also among yourselves. So please use these dialogues as a learning process, as a knowledge sharing platform, but also to trigger joint work and to advance this specific topic on heat, but also the other topics that we're going to discuss as we move along with this series of dialogues. We are pretty much interested in working in heat and health plans and supporting not only the region, but also countries in particular. So I thank so much for all the information that was shared. Now, Francesca will guide us a little bit about the next steps on these transatlantic dialogues, this series of dialogues that will have some moments, hopefully during COP29, COP30, and many other exciting events. And thanking everyone, the interpreters and our colleagues that worked on the backstage to make this dialogue a success from PAHO side, from Europe side, from HHS side. So thank you very much for all your support. So Francesca, the floor is yours. Thank you.
Thank you very much, Daniel, and thanks to the heroical ones, the 88 that I still see online. So before the last bits of your attention vanish, I'll be very happy to wrap up this meeting with a forward-looking, closure. So, of course, we were super excited of having you with us today. As we have seen, chats, going on discussion boards, and we just regret that we couldn't allow for more of this discussion to take place right away and today. But of course, this is a clear sign that there is an appetite, that perhaps we are doing something here that resonates well with those who are joining. So, as I said, this has been the inaugural dialogue, and we are happy and pleased to see that it went so nice and smoothly. And so we are looking forward to the next one. So watch this space. The next time we will convene again early in September. And perhaps you will not be surprised to know that the topic that will bring us together this time will be around something all of you have been speaking about, aspects related to governance, institutionalization. So watch this space for that. The other two things that are worth highlighting here is that it seems we are creating a new beautiful platform to continue this exchange. You have already heard about the idea of the policy briefs, the idea of developing and bringing to fruition the case studies we heard about today, but also more. I can see in the chat that there are calls to say, bring us, give us, tell us what you are doing and how we are doing that. So this is exactly the purpose why these dialogues were set up. We see opportunities to work together on communication aspects, on the heat health action plans, how we can populate and harvest your knowledge and experience. But we also heard about the partners, USAID and the US. You can be our partners and the partners of election in the countries to push the agenda forward. So we hope to be able to continue the dialogue also offline, particularly to feed this need for capacity building. And I think that with this, I will say this is just the first milestone. Early September, after the hopefully not too hot summer break, we will be reconvened there. But the path spans 2 years. In end of this year, we hope to bring this platform somehow in whatever form to Baku, and then from there get the energy to leapfrog towards Brazil next year, obrigada, and looking very much forward to a COP30 and take all these beautiful experiences on the way forward. So thank you very much for being with us today. Thanks to the interpreters, thanks to all the colleagues and to all the speakers who joined us for a beautiful, beautiful afternoon for us, morning for you. Have a lovely dinner on this side of the Atlantic and a lovely lunch on the other side of the Atlantic. So goodbye and see you soon again.
Thank you all.